Good morning, everyone, and welcome to this edition of the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs. Good morning. We want to welcome you to the second meeting of the Legislative Committee. And those of you who are here, let me just take care of some housekeeping notes, and that is, if you will, check your phones, check your beeper. I don't think we've had those in a while, but if you got anything that sounds like fruit, apple, or whatever, make sure that you got it turned off so it doesn't, go beep in the night while somebody else is testifying. The committee's meeting materials can be found on the Nevada Legislature website, and you can also sign up for electronic notifications related to any activity on the committee's website. If you wish to testify in person, please sign in at the table by the door. If you do not testify, you can also sign in at the door so that there's a record of anyone who is interested in the particular topic. And in the event the committee needs to contact you later. When testifying in person, please turn the microphones on to speak and speak directly into the microphones. We have listeners that are online, and if you don't speak into the microphone, they cannot hear you. So in the event that you're afraid of it, I promise you we have defanged it and it will not bite you. So get close enough to speak so that people who are not here, who are listening, who are listening virtually can hear. We'll have public comment period at the beginning and the end of the meeting, and public comment is limited to 2 minutes per speaker. In addition to testifying in person, members of the public may provide public comment 4 different ways. You can call 888-475-4499. That's 888-475-4499. And the meeting number is 825-4873-1419. And all this information is on our website. You can email your comments to seniorvetawsn@lcb.state.nv.ns or mail in written comments to 401 South Carson Street, Carson City, Nevada, or fax 775-684-6400. And with that, Secretary, please call the roll.
Senator Dondero Loop.
Here.
Senator Krasner.
Here.
Vice Chair Brown May.
Here.
Assemblyman De Silva. Assemblyman Gray.
Here.
Chair Spearman.
Here. And please mark Assemblyman De Silva present when he comes. He had another meeting that he had to attend, so he'll be here about 2 o'clock. But welcome present once he does get here. Senator Krasner, we're missing you here. I haven't seen you in person. But anyway, we'll talk. Yeah, we'll talk. So let's get started. We have public comment right now. Anyone here that would like to make public comment? Public comment. Broadcast. Anyone on the phones?
To provide public comment, please press star 9 now to take your place in the queue.
I think we have someone at the witness table in Carson City.
Yes.
Okay.
We
Please
also
proceed.
have a caller on the line that's currently unmuting. I'm so sorry.
Okay. Okay. Well, Carson City, if you hold up, let's get the person on the line. Okay. Okay. Broadcast, we're ready for them.
Good morning. Could you all hear me?
Good morning. Good morning. Yes, ma'am, we can.
Good morning, Madam Chairperson and the rest of the committee. This is Dora Martinez, representing the Nevada Disability Peer Action Coalition. I just want to thank to all of you in the past session for passing bills that benefits not just the population for people who are visually impaired, hard of hearing, and low vision, but everybody else. And I want to remind you that this month is Disability Development Awareness Month, and Women's Month, Social Workers Month, and Happy Day month. So I just want to thank you so much, Madam Spearman, and I hope to talk to you regarding a Braille bill. Maybe I'll take that offline for low vision and students, K-12, who are totally blind, who are not getting adequate services for learning Braille. Thank you for all that you do, and take care. Enjoy the sunshine. Thank you, Madam Chair.
Thank you. Thank you. Broadcast, anyone else on the phones?
That was our only caller, Chair.
Okay, we'll go back up to Carson City now.
Good morning. My name is Abby Bernhardt. I'm a board member with NAMI Nevada. I wanted to let you know that we are having our 2024 NAMI Nevada Annual Education Conference on June 18th. This year, the topic is Invisible Wounds of Veterans, Serving Those Who Have Served, Together for Mental Health. It's an opportunity to earn CEU credits and learn about the invisible wounds that our heroes have. Please join us at Hometown Health Great Basin Room 10316 Professional Circle, Reno, Nevada, available in person or virtually on June 18th, 2024. Thank you.
Thank you, ma'am. Do we have anyone else? Anyone in Carson City? Anyone down here in Las Vegas? And for those of you who are maybe new to the committee meetings, we don't comment on public comment. We simply take it in. And if there's some things that need to happen afterwards, they can either contact us or we'll contact them. So that's why there were no questions during public comment. Okay, seeing none, let's move to agenda item 3, approval of the minutes for the meeting on February 14th. Members of the committee, are there any questions regarding the minutes? Seeing none, I'll entertain a motion to approve the minutes.
So moved.
We have a motion by Senator Dondero Loop. Now I have a second.
Second.
Second by Vice Chair. You can get the next one. Second by Vice Chair Brown May. Any discussion? All those in favor say aye. Aye. All opposed, nay. And the ayes have. There we go. Today is going to be, I think in some respects, an emotional day because we've got some topics that we'll be discussing that that deal with a lot of life circumstances. And I have an opinion, a theory that if you don't die young, you're going to get old. And so far, nobody has disproven that to me. And so I want to welcome those who have taken the time to come and talk to us about these various subjects. And we'll move now to agenda item 4, presentation on Alzheimer's and dementia by the Alzheimer's Association. Mr. Shalnor, please begin when you are ready.
Thank you so much, Chair. And I'm realizing this is my first time down here in the Grant Sawyer building. Usually I'm in Carson City, but I wanted to make sure I was here with you and with the majority of the committee. But yeah, thank you so much. Good morning, Chair and members of the committee. My name is Benjamin Challenor, and I am the, can you hear me? Yeah, okay. I'm the Director of Public Policy here in Nevada for the Alzheimer's Association. Again, thank you so much for the opportunity to be here to present on Alzheimer's and dementia here in the state, and what we are doing, what we've done in the past, and what we want to make sure we're doing for our folks here in Nevada living with Alzheimer's and dementia. But before I begin my presentation, I want to introduce Amy Peterson. She's one of our amazing advocates with the Alzheimer's Association here in Nevada, and she'll be telling her story. So, Amy.
Chair Spearman, Vice Chair Brown May, and members of the Interim Committee. For the record, my name is Amy Peterson, and I live in Boulder City, Nevada. I'm here to talk to you today about Alzheimer's disease and the impact that it has on families here in Nevada. My husband, Drew, was a commercial pilot who voluntarily surrendered his license and quit flying at the age of 47. He was eventually diagnosed with a younger age onset Alzheimer's, and he died just 2 weeks after his 58th birthday. The last few years of his illness, it was not safe to leave him unattended at home, so I resigned my job as a teacher with the Clark County School District to become his full-time caregiver. I have been an Alzheimer widow for nearly a decade now, and today I am a full-time volunteer with the association. I facilitate support groups for caregivers. I increase, hopefully, dementia awareness through presentations and educations to a variety of groups throughout Southern Nevada. And I advocate for legislation and services that will ease the burden of those diagnosed with dementia and their families who are equally affected. I'm passionate about helping those in our community who are trying to maneuver the complex health system after having such a devastating diagnosis, and it's my way of honoring my husband's memory. It was really difficult to get an accurate diagnosis, especially at such an early age for Drew. His primary care physician saw him every 6 months for a flight physical, but missed the signs of cognitive decline and initially diagnosed him with stress and depression. A common lament that I hear often from my caregivers in the support group, spouses, family members, is the difficulty that they go through trying to get an appointment, trying to decipher the conflicting reports between doctors, and it is incredibly frustrating to try to get their loved one diagnosed early and accurately. Unfortunately, after a series of appointments and various medical tests, a variety of specialists, they're given a diagnosis, but with little follow-up on what to do now, how to do it, where to turn for resources, and what to expect. On the caregiver note, the intense responsibilities of providing care for someone living with Alzheimer's or another form of dementia take a toll on the caregiver. Providing that care can be emotionally, physically, and financially draining. It's a life-changing role, and while we do it mostly out of love, some out of obligation, very few of us are adequately trained for the medical and nursing tasks, let alone prepared for the daily mental and emotional changes and the physical declines that our loved ones go through. Caregivers often neglect their own health needs when they feel overwhelmed, and statistics show that over 60% of caregivers will succumb to a serious illness or even death unless they get additional help. It seems to me that we need standard routine screening for seniors and others experiencing memory or cognitive issues. And this screening needs to be available to all residents, especially in rural or otherwise underserved communities. With an early and accurate diagnosis, the outlook on living with Alzheimer's can be improved with new research and medications, lifestyle changes, some education, and social and emotional support for the patient, and more importantly, for their caregivers. I want to thank you for your time and consideration in hearing my story.
Thank you, Amy. And I definitely want to start with her story, because her story is one of many that we have here in the state. And I'll pull up the presentation in a second, but our logo, it looks like two round things, but they're supposed to represent the brain in the person and the beaker in the science. And that's who we are here in the Alzheimer's Association. We are person-centered. We are also data and science, and making sure that we we do everything data-driven, but we're also people-centered. Okay. And so before I begin, I just want to clarify one distinction. We are the Alzheimer's Association, but our full name is Alzheimer's and Related Dementia. There's dementia, which is an umbrella term for memory loss and cognitive decline that is serious enough that it interferes with everyday life. Alzheimer's is the most prevalent. It makes up about 60 to 80% of all dementia cases. Others are vascular, Lewy body, and frontal temporal dementias are the other more prevalent ones. I realized after I sent the presentation in, I did not include that, but I want to make sure I made that distinction up front. When we say Alzheimer's, we're not leaving out other dementia. This is just a general overview. Like I mentioned, a bit about the Alzheimer's Association, some facts and figures at the national level, Nevada facts and figures, some federal priorities so you know what we're doing at the federal level, as well as our state priorities, what we've done in the past and what we want to make sure we're doing in the future. So our vision as the Alzheimer's Association is a world without Alzheimer's and all other dementia, plain and simple. And we're doing that by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. How we do that is through three main pillars, so to speak: care and support. This is through our direct services that we provide at our offices, both at the national and the local level. This can range from caregiver support to education for health systems or businesses or everyone in between. Research, the Alzheimer's Association is the largest organization that provides support for Alzheimer's and dementia research. And lastly, but not least, is advocacy, both at the federal and local level. We're always fighting for ways that we can make sure we're helping those living with Alzheimer's and dementia. Any way that we can make their lives easier, lives that they can live a more fuller life after a diagnosis, that's what we're here for. Here in Nevada, we have two offices, one in Las Vegas here, down in Cimarron Road, and up in Reno, and the United Way building. We're open 5 days a week. You can always stop by. We're available, and I have the other contact information at the end. Some of the services that we provide here locally, as I mentioned, are caregiver support groups. Amy here was one of the facilitators for that, and she still continues to do so. Training and education classes for caregivers, providers, first responders, and for anyone that wants it. We provide these education services to everyone. A colleague up in the north is going to be doing an education class to the Northern Nevada Labor Council. So any organization, any person that is interested at all, we are able to provide those education classes. Here shortly, Amy, as soon as we're done here, is going to be going to UNLV to do a lunch and learn as well. And one of the other things that we do is we provide a $1,000 yearly respite grant, and that is, we are the state provider for that respite grant. So it's through ADSD, and we provide that. And one thing I want to make sure that I talk about before we continue on to the facts and figures are 10 healthy habits for your brain. This is something that we came out and published early this year. And it's 10 healthy habits. It's a public health campaign launched by the Alzheimer's Association that provides easy to understand brain health strategies to reduce the risk of dementia. And it's never too early, never too late to start these. And I did provide these as a handout, and folks should be able to see it on NELIS, or not NELIS, on the legislator website. And so, national prevalence, we have nearly 7 million seniors living with Alzheimer's, 6.9 to be more precise, and these are folks who are 65 and older. We found this number by using the most recent census data, 2024, and a study, CHAP study, the Chicago Health study that looks at Alzheimer's. This is one of the instances where, when I say Alzheimer's, it does mean Alzheimer's. The study only looks at Alzheimer's, but we know that there's so many more also with dementia. And specifically, one distinction that I want to show with this prevalence is that 2/3 of those are women. Older Blacks and older Hispanic and Latinos are disproportionately more prevalent for Alzheimer's and other dementias. We don't know specifically why there are these health disparities between the Black African American community and the Hispanic and Latino communities. There's not enough research that's being done right now. Obviously we're doing as much research as possible. One of the reasons may be for socioeconomic reasons. For years, these communities have had health disparities, lack of good food, lack of extracurricular activities. If you look back at the 10 healthy brain habits, some of those, heart disease, high blood pressure, diabetes, run high also within these communities. And so if they're not able to manage those, then they also are more prevalent for that. And then for other ethnic and racial groups, we're still working on trying to make sure we find more data to be able to identify prevalence there. Caregiving, more than 11 million Americans provide unpaid care. So if you take a look at that number, 6.9, nearly 7 million Americans, over 65 have Alzheimer's, and over 11 million, that means there's, to each person living with Alzheimer's, there's more than one, 1.4, I believe. And they contribute to about nearly $350 billion of unpaid care. So that's folks who, just like Amy, I know a lot of folks have a story in the connection to Alzheimer's and dementia. On my family, my great-grandmother on my mom's side, and then my grandmother on my dad's side. On my dad's side, they were able to put my grandmother in a home, in a facility, and she was able to get taken care of there. But on my great-grandmother, she was taken care of by my grandmother. All that work and all that caregiving support was done by my grandmother, unpaid. So it's significant there. Where was I? Sorry, I'm pulling up. Realize I didn't scroll down in my notes. There is also workforce shortage across the country, and I'll be able to show more closely for the Nevada numbers, but there are about 1 million additional direct workers needed for this to make sure that we're helping folks. And this is across the board. These are primary care providers. These are specialists, neurologists, geriatricians, psychoneurologists, folks that could help diagnose and help provide the care needed. And there's a shortage of dementia care specialists that help bridge that gap from diagnosis to receiving the care. Here in Nevada, we have just under 55,000 Nevadan seniors living with Alzheimer's. When you look at the total population of Nevadans over 65, that's a prevalence of 10.6%. So in other words, 1 in 10. And that's, we are not one of the highest in the country, but it's still pretty high. And there are a lot of ways that we could try to make sure that we're looking towards providing the care that's needed for that. And here in Nevada, we have 84,000 caregivers providing 142 billion hours of unpaid care. And that totals up to about $2.3 billion of unpaid care. And that's significant. That's a lot of families out there providing that care. So some of our federal priorities that we're working on, it's a BOLD Reauthorization Act. This is a reauthorization of the initial BOLD Act, and this is building our largest dementia infrastructure act. It was passed in 2018, and our very own Senator Cortez Masto was one of the initial sponsors. She is also a sponsor for the Reauthorization Act. Her, along with 3 other senators, introduced it initially. This provided for additional support, this provided for funding towards the CDC. This provided funding towards state health departments so they could build out an infrastructure. In that initial round, we were one of the states to receive that. I believe it was about $1.4 million for the initial 5-year run. And we, the Alzheimer's Association, with the Department of Behavioral Health, Public Behavioral Health, and our partners at the DEAR program up in UNR, are working towards making sure that we are utilizing these funds and utilizing the help that we are able to receive from the BOLD Act to make sure we're doing public health awareness, reaching out to health systems, and making sure that we're helping bridge that gap. The BOLD Reauthorization Act, if approved, will be able to extend out till 2029. And then we also have the NAPA Reauthorization Act. This is the National Plan to Address Alzheimer's. And this was initially passed in 2012, and this was the first time that we were able to actually have a plan to address Alzheimer's. The current plan is set to expire in 2025, and this, if we're able to get the reauthorization to pass, we'll be able to get it to be approved through 2035. The goals that we were able to do is, make sure that we were able to effectively help our families living with Alzheimer's. And one update of both of these, they just, I believe, received the markup and will be up for a vote out of committee either shortly. We just received this news this week, so this is great news for these. There's hundreds of bills that were heard in this committee that they were assigned to in Congress, and we were able to get these moving along. And the BOLD Authorization Act was just introduced, if I remember, sometime in February. So this is great news for us. And one that I was not able to include in the presentation before I submitted the slides, and I didn't want to change up the slides too much from what you have, is it's called the ADAPT Act, and that was introduced early last week. And that looks towards our workforce education, primary care providers, making sure that they are trained on Alzheimer's, trained on dementia, trained on how to be able to give a diagnosis, to be able to help speed up and get an accurate diagnosis sooner. And so that's through our Project Echoes that are across the country. We have one of those up in Northern Nevada through our School of Medicine, and we have one down here in UNLV as well. And now, 2023 recap. We had a handful of bills that we were working on. Some were able to get passed, some were not. AB 208, which has created a new structured family caregiver Medicaid voucher specific for dementia, was able to get passed. Right now, through ADSD and through Medicaid, that's in the process of working on that application to get it submitted to CMS. And that's going to be able to provide, it's similar to the structured family caregiver Medicaid voucher that we currently have. But in order to be able to target folks for dementia, we had to create a new voucher for it specifically, rather than amending the previous Medicaid voucher. The other bill that we were able to get passed is one that we came on towards the end to support after folks reach out to us, which is creating the Nevada Neurological Disease State Registry. That was SB 390. And that's a state registry where providers will be able to take note of diagnoses, take note of different aspects and data points of a diagnosis, and de-individualize it and upload it to a state registry that's based out of the UNLV Brain Department. And that would help us be able to identify patterns across the state. Two bills that we were not able to get passed was SB 297 that would have set up the Nevada Memory Network. That one stalled in finance, Senate Finance, and AB 167, Dementia Care Specialist. That one also stalled in Ways and Means. For clarification, I came on mid-March. I believe it was March 15th of last year. If you do the math, that's about 3 weeks left of legislative session. And so my predecessor left mid-session, and there was not enough work done on these bills to make sure that they were able to get across the finish line, because by the time I came on board, the budgets were all locked up and most of the conversations were already happened. And so these are definitely ones that we're going to be looking at to see how we can bring back for next time, because they're amazing opportunities for us to be able to do great work here in Nevada for those living with dementia and Alzheimer's. One note I do want to say is the DEAR program up at UNR, they are able to, they're working on a dementia care specialist pilot program. They haven't hired anyone on, but it's through ADSD, and they're working up on how that will look like, and hopefully we'll be able to get some information on how that's been working, and so we could be able to provide the legislature next session with more information on that, as we're hoping to bring that back. And so one way that we work towards identifying policy priorities here in Nevada, we have what we call the NISP, the National Statewide Policy Priorities. And they're general guidelines, general guides, I should say, on what the Alzheimer's Association should work on in individual states. And that's increase access to care, support, and treatment, improve quality care, advance risk reduction, early detection and diagnosis, and ensure coordinated statewide response to Alzheimer's. Some of the upcoming policy ideas that I have align with this, some more with others, and there's other ones that I'm trying to identify through the conversations we're having in the community as well. And so one of those that I definitely want to bring back, and I'm currently working with stakeholders through previous ones that we've worked on, as well as our task force, which I will touch on in a little bit, is the Nevada Memory Network. It's based off of a program that started out in Georgia, and it's been pretty successful. But the five main goals there to improve screenings for Nevadans through the Medicare annual wellness visits, establishing memory access assessment clinics, or hubs, as we called it in the process, but one in Northern Nevada, one in Southern Nevada, and making sure we're able to get an early diagnosis to get the care started sooner. And the one piece that that Amy addressed or spoke of in her presentation that would definitely help here would be including a dementia care specialist or dementia care navigators in this, to make sure that we're able to connect folks after diagnosis from a specialist to their primary care, to the resources that's available throughout the community, whether that be through us, through our partners at DEAR, or Dementia Friendly Nevada, or wherever there are resources, making sure that folks are being connected with that. And how that look like is basically a system of care. You start up with the primary care. They start identifying symptoms, and they are able to provide a pre-diagnosis or a diagnosis, send that over to the memory assessment clinic, where they're able to provide the full diagnosis and treatment plan. send them back to the primary care, all at this while having communications back and forth, as well as a care navigator being based at the memory clinic or at the hubs, where they're able to make sure that the communication between the primary care and the specialists are happening. There's a warm handoff. There's no information being dropped, and making sure that we're getting folks, once they do have that diagnosis, with the care and need that they have. One other piece of this would be provider training. So whether that be a physician, nurse practitioner, physician assistant, making sure that they are getting that dementia training through the hubs. Right now, or in the previous iteration of the bill, we worked with the Lou River Center down here at the Mayo Clinic, Cleveland Clinic, sorry. Amazing partners that we have. We work with them almost on a daily basis. Up north, it would have been Renowned Neurology, and then would be the UNR School of Medicine through the Sanford Center, and then the UNLV School of Medicine, the Brain Health Department. We've been, initial conversations have been happening with the stakeholders to make sure everyone's back on board, but that's who we worked with in the past, and one partner that we know is ready and gung-ho and wants to make sure that we bring this back is the Lou River Center, so really excited to be working with them on this again. One other piece that we want to be looking at is dementia training, making sure that requiring dementia training for these folks, court-appointed guardians, making sure that they, this isn't multiple classes, multiple 5-hour classes. These are, if I remember correctly, 3-hour classes that we have that we are able to provide both in person and I believe virtually, as well as first responder training. Currently, we reach out individually to different departments. I know in the past, I think it was late last year, we did one with the Henderson Police Department, actually with the entire city of Henderson. The full dementia training for first responders, so that was their fire and police, and then I think it was just the 10 warning signs for the rest of the city staff. And so I think there's a great opportunity to make sure that we're having folks being able to identify that, because when folks get sent out, or when first responders get sent out on a call, they need to know how to be able to respond to that if the person does have a diagnosis of dementia. Just like with mental health, we want to make sure that folks are aware of how to respond to those calls, and making sure that folks are being safe there. One other last piece here that I wanted to mention was the Nevada Task Force on Alzheimer's. That is it was passed in 2013, and they're tasked with publishing biannually the recommendations as well as a report to the legislature. And we have, I forget how many folks on there, but we have 2 legislative appointees, one of them being our esteemed Senator Dundera Loop on the committee here, as well as Assemblyman Dewey Gwynn. And then we have stakeholders that are either caregivers or actually providing, that are providers. The Lou River Center has a couple of folks on there. We have folks from the Sanford Center up in Reno, the Deer Department, and across the state, and it also includes a rural representative. And so we also have a representative on that, and so we work together to make sure that we'll be able to provide some recommendations both to the legislature as well as to our local agencies as well as our state agencies. And one, I'm realizing now that I didn't include, but was talked at if you were on the Interim Health Committee. This last meeting was the biomarker registry or biomarker access, expanding that to include other diseases aside from cancer. Alzheimer's and dementia would be one of those that we would want to make sure that we are increasing access or insurance coverage. And so that's one other one that we wouldn't be leading on, but we'd be partnering with the American Cancer Society. Lastly, it's contact information for myself, as well as a 24/7 helpline where we have folks trained. If you have any issues or any questions or concerns, you want to know, is this a symptom? Is this, or how I should do this? That 24-hour helpline is there available. I forget how many languages, but there's so many languages available if you call that. And then locally, those are our offices as well. And that's my presentation.
Thank you. Committee, any questions? Okay, Vice Chair May.
Thank you, Chair. Thank you for the presentation. My family also has Alzheimer's, and my dad is a direct caregiver and primary care provider for my mom. And so my question really is about the state of Alzheimer's supports here in Nevada. Thank you for sharing your story. In that testimony, you noted that families don't have answers to what to do, how to do it, or where to go next. It looks like the Nevada Memory Net system of care is a possible start to that solution. So can you talk about, do we have care navigators now that we can access? How many folks are we serving out of the Alzheimer's Association here in Southern Nevada? Like, how many families are in services? And then is there follow-up when people drop off? And I ask that question because my dad is 91, and he will not proactively pick up a phone and say, I need help. But if a nurse shows up at his door, he will open the door and let them in, right? And so I'm curious to know, how are we following up with that type of family?
So I'll be able to answer the initial part about the MemoryNet, but the question specific to the Southern Nevada, I have here our regional executive who'd be able to answer that. But yes, the Nevada MemoryNet, what we call it for short, would help bridge that gap, help bridge that, because yes, folks, when they get a diagnosis, oftentimes they don't know where to turn to, they don't know what's next. Even if they are handed some papers, like, here's some resources that are available to you, just like you said, some folks just don't pick up a phone. And so that's a key piece of the MemoryNet, is being able to have that dementia care navigator be able to have a initial sit down with them and say, okay, let's take a look at everything that is going on in your life right now and how this new diagnosis is going to impact it, how we can help you get set up at home with it, how we can make sure that you're seeing, you get your appointments scheduled up, what are the resources that you need, okay, based on how your home life is, these are the resources that we can connect you with. And so that is, there's very many important parts to the MemoryNet, but I think that's probably the most important piece after the initial diagnosis. Because if we're not able to provide the care, provide the support needed once you receive a diagnosis, then we're failing folks. And so that's one way that we want to make sure we are helping that. And so right now, there is no specific dementia care navigator. In the initial bill language, we eventually amended it to be community health workers, because that's what's already in statute. We wouldn't want to create anything new. But dementia care community health workers that are specialized or trained in dementia. And so at these hubs, they would be able to hire community health workers, social workers, and be able to train them in being able to handle these cases. And so we don't have any number on that specifics on how many we have right now, But if we're able to get this passed, then we're able to get, folks to come in, get them trained up, and to be able to provide that care. And hopefully be able to expand out. Right now, we're looking at 2 hubs. It's a model that could be expanded out to be, Southern Nevada could be seen to have multiple hubs where there could be even more dementia care navigators.
For the record, my name is Phil Kalsman. I'm the Executive Director here in Southern Nevada. And thank you very much for your question. This is a challenge for us, for sure. We're working with one of the most independent generations of our lifetimes. And the last thing they want to do is ask for help quite often. So what we often do is plant the seed, and we let people know what to look for so that they will then have the courage to pick up the phone and give us a call. We're working with hundreds of families, frankly, here in Southern Nevada and in Northern Nevada as well, throughout the state. But we don't know how many people we've reached necessarily unless they call and we can develop that relationship with them. We have all kinds of follow-up. We have 2 full-time staff members here in Las Vegas, 1 in Reno, that their job is kind of like that social work connection with the families to help them navigate this as best they can. But to the point here, it's a difficult road, and we have the 24-hour helpline that people can call in the middle of the night if they need to, but we work with families as long as they need us to be a part of their care plan. And they quite often go on to become volunteers, like Amy. So hundreds here in Southern Nevada, to answer your question.
Thank you. I just have one follow-up, if you don't mind, Chair. Can you tell me how is that support service funded? And the reason I ask that question is because often we talk about state support services, right, funded through Medicaid, waiver dollars. Particularly, it seems like that's part of the component, right? So it's how you bill for services. But what about families who don't qualify for Medicaid services that are primary caregivers and just need social and emotional support or a little bit of guidance? Are they able to access your programs? How is that funded for you?
Absolutely. So a couple of things. We are fortunate to receive funding through ADSD in the respite program, and we're able to provide families up to $1,000 per year for respite services. We also, in the BOLD Reauthorization Act, we're funded to help educate, and that program is just getting started. We're excited about that. That's a statewide program. But frankly, the rest of it is from community support. We have a thing called Walked Into Alzheimer's, and that's what helps support these very programs. And we have a lot of volunteers like Amy who are doing it out of the kindness of their heart and who are, providing services for free, frankly.
Senator Don Darrell.
Thank you very much, Madam Chair. And thank you for being here today, and always good to see Amy. So I have a couple questions that probably might just be yes or no's. But so how are police, fire, ambulance, people that may be called to a scene for whatever reason? Somebody's lost, somebody's at home with someone, I don't know, somebody falls, whatever it may be, but then they get there and they don't know that that person has Alzheimer's. So are we training, and my guess is yes, but I just want to hear it. Are they being trained so that they understand the symptoms and recognize possibly what's going on, especially since that person may not be able to tell them? Yes. The answer is yes. All the above. There's a gap certainly in what we understand about dementia and how to communicate effectively. But we just recently met with Red Rock Search and Rescue because they're doing a lot more urban searches for people who wander. And one of the obstacles that we're having is just communicating effectively from the family's end of it to the first responders, letting them know my family member
is wandering, or my family member has dementia or Alzheimer's, and then just letting the first responders have some insight as to how to communicate effectively and how to interact effectively with this person.
Thank you. And follow up, Madam Chair. I was glad to hear that you are working with the Ruvo Center. I think that's really important piece of this puzzle that we're trying to put together. But also, have you done, and I think I've seen something, but I don't think it's been what I'm thinking of, on TV, PSAs that may give somebody just like Amy, who's at home, or just like the Assemblywoman's father, who may give them the opportunity to say, oh my gosh, there's a number I can call. Simply, sometimes somebody's seen something like that on TV, they can feel okay about calling because they still are a little bit anonymous, right? They're making a phone call, they're not in front of somebody, and asking for help or asking symptoms or asking all kinds of questions that they may have because they're starting to see things are going awry, but they don't know what to do. They don't even know that you're, and frankly, you just opened your office here, so they don't even know that you're here, right? Or they don't know where to go. So has there been any outreach like that, PSAs, Facebook ads, I don't know, all the things that people might be looking at or watching, so that we can get that information out to them and allow them the opportunity to get that information?
Ben Challoner for the record. Yes, we do. Our national, our home office, they work to make sure they're putting out ads and updating those and making sure they're in their languages and cultural competency as well. I believe there's a different set of ads that we work with. I believe the Ad Council to get them put out. I personally have seen them in Spanish at home when my father-in-law is watching his news programs. They come on and mention, certain things are part of regular aging, while certain things are not. If you're not sure about what is, give us a call, and it's the phone number. Facebook ads as well. We have ads going, social media ads as well. You can pull them up for both our information that is available as well as for the events that we have. Phil mentioned the Walk to End Alzheimer's. I know that's one big piece that we advertise a lot come October and the weeks leading up to that. And it's not just a big fundraiser, but it's also an opportunity for folks to come and even find more information because we have information booths from ourselves as well as our partners that we work with on a daily basis that are there.
Thank you. And I don't know that I've seen those. That's why I ask. And because there are also, we have weekend, like we just had one, a big senior expo, right? And all those kinds of things. Every time you go, if you touch 5 people, they're telling 25 people that they know or they play bingo with. I don't know, right? But it's sometimes word of mouth. And I've watched this happen with mental health, with MS, with everything that we do. So I just feel like that's a really important piece. Thank you very much, Madam Chair. I may have more questions, but that's it for now.
Thank you. Any other questions? Senator Krasner? Yes.
Thank you, Chair. Yes, I did have a question. You mentioned, and thank you for your presentation. You mentioned in your presentation something about the biomarker sharing. I want to make sure that is an opt-in process where the individual or their family member who's responsible for them opts in to that sharing of someone's DNA. Because I just feel like there's some privacy concerns when we're starting to share people's DNA without their knowledge or consent. There's privacy concerns. And then down the road, if they happen to get dropped from their insurance and it's really for some other reason, or who knows what, it's shared with other parties, it's just privacy concerns. So I just want to make sure that that's an opt-in if you could help me out with that. Thank you. Thank you so much.
Ben Jellner for the record, Senator, and I misspoke. I did not mean to say biomarker registry. I meant to say biomarker coverage by insurances. That's that piece that I meant. I had my slide up from my previous slide that included I was thinking about the registry, the neurological disease registry that is de-identified. There's no personal information that is connected to the patient. There is that piece, but the biomarker there's no biomarker registry. It's a biomarker coverage for insurance. And I apologize for misspeaking there.
Okay, thank you.
Assemblyman Gray? Questions?
No, ma'am.
Okay, thank you. So I just have a couple. So insurance to cover the testing, I think that's what we just said. Do all insurance providers participate?
Ben Jellner for the record. Chair, currently, they're not required to cover it. For the testing, a CT scan or a PET scan, they may or may not cover that. There's other types of testing that are not covered by insurance, and that is what we're looking at through the national coalition as well as the state coalition to make sure that they cover that. And right now it's only all biomarkers for cancer. So if you're trying to get a cancer diagnosis, then only medically necessary biomarker tests are covered.
Yeah, so what concerns me is, I want to say maybe slide 4, the disparities in Black and brown communities for healthcare, and COVID-19 was revelatory, and I say it's revelatory, but the information that burst on the scenes, those of us in those communities already knew that. So it was not news to us, but it was news to everybody else. So in your stakeholder meetings, are you including the insurance companies?
Ben Jellner for the record. Not yet. For the biomarker coverage, we haven't been leading those stakeholder conversations. That is the American Society of Cancer, or American Cancer Society. They're leading those conversations, so I can't speak to that yet. But as for anything else, we haven't looked at anything specific to mandate insurance coverage of anything yet. I know now that we like to call in the era of treatment, we have 2 treatments available for Alzheimer's that Medicare and Medicaid cover. But as far as coverage for private and other public insurances, we haven't looked at that yet. Once we start looking at that, obviously we will make sure that insurances are part of the conversation.
Yeah, and I think it would be wise for that coverage because we are a grading state. And by, if I remember the numbers correctly, by 2042, the vast majority of Nevadans will be over the age of 50. So if we're not looking at that now, we're going to be in trouble by 2040, 2039. So next thing, so are you all doing anything at all with the VA? Oh, I'm sorry. And AARP would probably be interested in joining that partnership to make sure that it's covered. Okay. Are you all doing anything with the VA? Any partnering with the VA? Because some of the people in your, and that might be a question that you ask family members who either volunteer or who come for support, because if they're veterans, then there are services that can be covered, and whatever you have in terms of funding can be stretched because you have people who can get that service from another place. So,
Ben Challoner for the record. I believe AARP is part of that coalition, so I know that I've been meaning to connect with them on the rest of our issues. I know they just hired on a new government affairs person, so I've been meaning to reach out to them to make sure that we're working together on a lot of our issues, because there is a lot of overlap, absolutely. As far as the VA, I do know that we work to try to make sure that we connect with different health systems across the state, and the VA is one of those.
Because, we changed the forms, state forms, don't ask anymore, are you a veteran, but we ask, have you served? And so that's because there's some people, if they didn't retire, they don't consider themselves a veteran. So I don't know what you put out there in terms of people letting you know that they were a former service member or that they're a veteran, but that would probably be wise. The next thing I'd say, and this is along the lines of Senator Dondero Loop's question, are you all doing any type of outreach to the faith-based community? And I'm thinking now, most churches have something called an announcement time or whatever, and it might just be a good idea also there's a shepherd's breakfast here, and you go to the shepherd's breakfast and make this call, because many of the people that are in churches today are over the age of 45. So, just question. I see hands ready for the mic.
Phil Kalsman for the record. Thank you for your question. The answer is yes, we absolutely are. That is a great community. It's a great system, frankly, for us to reach a lot of people, and we are getting more involved. We're very involved now, getting even more involved in the faith-based community.
Thank you. Vice Chair Brown-May.
Thank you, Chair, for the indulgence. I just would like to point you in the direction of Assembly Bill 100, which is a caregiver assessment bill we passed last session unanimously. It requires that the Division of Aging and Disability Service work to identify who our family caregivers are so that we can get them into some system of service. They're currently working to craft that pilot program, and so it would be perhaps a good idea if you are interested to follow up with some representatives there as a way to get Alzheimer's included in that assessment.
Ben John, for the record. Thank you, Assemblywoman. One thing I also didn't mention is part of that bold work that we're doing. There is the preface, which if you just give me 1 second to find out what the initials stand for. It is I'm pulling it up, the Behavior Risk Factor Surveillance System. And they have different questions and on that survey that goes out. Each state is in charge of surveying the states, and part of that bold work that we're able to do, I love that bold work, is adding in a caregiver module to that as well. So to be able to identify those caregivers and the gaps that they have and how we can better support them. So that's through Department of Public and Behavioral Health. So I'll be sure to connect that with ADSD and everything on AB 100. So thank you, Assemblywoman.
Referring back to someone who made comment about the blind, that might be another option. Somewhere I read that hearing loss, if it's not addressed, could accelerate that. So are you doing anything with audiology doctors or audiology providers? Because, and I'm just trying to make sure there's no wrong door. No wrong door. So are you doing anything with them?
Phil Kalsman for the record. Again, thank you. That's a great question. We have not established any formal relationship yet. We are working on it, not only with audiology, but also with the dental community, because a lot of correlation between dental health. But with the audiology, loss of hearing, we see the social decline, the social withdrawal that takes place, and that just accelerates everything. So yes, working on it.
Thank you. One last question. I talked to Dr. Went and was over there when they had the memory, I can't remember, it was a memory event back in maybe November or so, and they were looking, there's medications that they're using, that they need more people, they need more diversity. So are you all looked into that? And is that information looped into your outreach?
Ben Challoner for the record. Yes, we have, through the Alzheimer's Association, we have, it's called Trial Match, and it's how we try to make sure that we are getting folks connected with those trials, whatever it may be, to make sure that we do get that, that diversity there. And it's, yeah, it is something that we're working on, and we're making sure that we're letting folks, both caregivers, those living with dementia, as well as providers, know that.
Thank you. Committee members, additional questions? Okay. Thank you all for the presentation. And if you can just do me a favor, in our last meeting, we're going to be looking at some recommendations for BDRs, and so would appreciate you all getting that to our policy person, Ms. Destiny, so that we can look it over. And, you know, Mr. Challoner, you know, earlier is better than later, so.
Ben Challoner for the record, and yes, Chair, I already have draft language that I can send over to ease that process. Thank you.
Thank you. Thank you. No further questions. Thank you all for the presentation. I appreciate it. We're going now to agenda item 5, presentation on program services and community. We're looking at women veterans, and I see a bunch of them out here. Is that right?
Where were you reading?
Huh?
You were reading?
Yeah. Agenda item 5. What?
Nothing.
Okay. I think we're going to move with Forgotten Not Gone first. No. And welcome Ms. Kelly Guidry to the floor. And just before you get, I just want to say that I am so impressed by the tenacity. I think I met you all 10 years ago or so, something like that, and you were just getting, and so thank you for your tenacity and just hanging in there. Okay? So with that, please begin.
Thank you so much, Senator. I'd just like to start out by saying thank you, and thank you to the Legislative Committee for inviting us to share. It's quite the honor, considering I consider the Senator a great inspiration. She was also in security forces, which was in the Army, Lieutenant Colonel, so a lot of what she's had to endure, I can relate. It definitely resonates, so thank you again. And then to my women warriors, thank you so much. Each one of the ladies behind me and beside me are very active in different things with the veteran community, all the way from MST, which is military sexual trauma, to just being there and getting veterans outside of their isolation and depression. Again, my name is Kelly Guidry. I am a co-founder, along with my husband, Peter Guidry, of Forgotten Not Gone. Before I get started, I'd like to just speak to the topic before, because it plays a great deal in my life. I am also the caregiver to my husband, who is a 100% disabled Air Force veteran as well, even though I am a disabled Air Force veteran. But I've been his caregiver since 2013. And I can relate to everything that the past presentators spoke to, not knowing where to go for resources, neglecting your own health as well, even though that is the space that I work in. It's pretty easy to get caught up in concern for the person that you're caring for more than yourself. So I commend them for that as well. Getting started, Forgotten Not Gone is proactive in veteran suicide prevention by addressing the triggers of suicide and why it continues to happen. Pretty much, to sum it up in a nutshell, we are suicide prevention through veteran peer support outdoor recreation. For the longest, like the senator said, it's been 10 years. This is our 10th year. We thought we were riding bikes. It was very clear after the second year that that was not what we were doing. We had a gentleman who rode with us almost every single day. We worked 6 days a week. And he let us know at the end of that year that we were probably the only reason why he was still alive. And we did not realize he had a veteran roommate that lived with him that took his own life. And he felt extremely guilty about that because he, like many people, when you talk to them, say, I had absolutely no idea. There was no signs. I talked to this person every single day. And so it became abundant and clear to us that we were doing a lot more than just riding bikes. My husband was pretty much the reason why we started Forgot Not Gone. He was really going through a really rough time. He had bilateral knee damage, back damage, and was medically separated from the military. And around 2015, he had lost a lot of weight, 154 pounds. He was having fainting spells. He was not sleeping at all, like maybe 2 hours a night. And if you're familiar with, any type of body recoverment, when you sleep is when you heal your body. So he gotten to the point where he couldn't really even speak and engage in a conversation because he had started to stutter. Cognitive was not well because he was not sleeping. We were then sent to the War-Related Illness Center in Palo Alto, California, which they put together a comprehensive plan for you. So we got to stay there for a week, and everything that was wrong with him, he got to see Stanford doctors. So he had MRIs, he had a torn GI tract, and so he was throwing up blood. They found out a few things, but at the end of that, they kind of put together a comprehensive plan, and we found out a lot of things that I was unaware of at that point. The young lady who he had to see, it was checkpoints that you had to go to, and I'll get to the part about when we got to see a chaplain, because our spiritual health has to be the number one reason why we serve and why we continue to be tenacious, like the senator said. But anyway, she asked at about 16 years of marriage, it'll be 26 in June for us, was there anything he wanted to discuss where I wasn't invited to that? And so I planted myself in my seat because I thought, what could he possibly have to say that I can't hear? And he put his head down to the table and he asked me to leave. And so I'm sitting outside and I'm thinking about a trillion things. Well, maybe it's this. Well, maybe it's this. Ooh, I hope it's not this. And when she came out with 5 gun locks. And at that particular time, we had 5 guns. We were both security forces in the military. And it dawned on me then. And I couldn't understand how I could be sleeping next to this person and not know that he had thought about leaving me here by myself. But we were so both unemotionally available for each other that it was just inevitable. And so she gave me the gun locks. We went to see the chaplain. And when we got back home, we read through the plan. And one of the things they recommended was a recumbent trike. And they said it would help with his anxiety. It would help with sleep because he would finally be able to move again, which we were very physical people, of course, being cops, and some other things. And I thought to myself, man, they put a lot of pressure on this bike that I've seen at the VA several times. But I was like, that's a lot of pressure to put on just that bike. But anyway, we realized at that moment, I had just gotten sober. I had got addicted to some pain pills that the VA gave me for fibroids. And when I realized I was addicted, my body really wouldn't let me stop. So I was fortunate enough to go through a recovery center. And when I started to get better, he stopped getting his medicine delivered to the house to support me. But it was through that process that he realized it had affected his cognitive behavior as well. And so in that instance, we began to go through faith-based spiritual. We realized that we needed to have some backup. Even though I was getting sober, I have chronic pain. And so now I had to deal with that without any pain medicine or anything. So that had to be addressed. And we just started reading the Bible and we started keeping the Sabbath. And I would have to say that 24-hour period that we devoted to ourselves and to our Creator really changed the trajectory of our life. and made us want to do for others. I've been a nurturer by nature for quite some time, but that really lit a match. Moving forward, when we got back, for whatever reason, the VA prescribed the trike. However, they would not purchase the trike. And so we took out a personal loan, and we bought 2 bikes. We bought the kind of Bullet, and I think we have the video. Dustin? Okay. You'll be able to see that and know what I mean. But we bought that one, and we bought a regular trike, and I'll point those out to you, so that I could ride with him when I wasn't working at the IRS, and so maybe a veteran buddy could ride with him as well. We had moved to Soho Lofts because, like I said, we had started to get on track as I got sober, and he came off the medication as well. They had him on pain and psych pills as well. And within 2 months, he was a different person. Soho Lofts is a mid-rise downtown, and it's at that particular time was doctors and lawyers, and Peter was not even speaking. And so when we came out, he's in the elevator and he's talking to everyone. How you doing, Leroy? What's going on, Tyrone? And they were calling him Vegas Vet. And I was like, he has a nickname? Like, what is going on? Who is this person? But come to find out, riding that bike, it's such a unique looking bike that people would come up and talk to him. Children would come up and talk to him. So it pulled him out of that isolation, out of his comfort zone. And that's what made the difference. And he just, after a couple of months, he was a different person. And he just told me, I really want to start a nonprofit. For veterans. I think no matter how much these bikes cost, they're worth it, and we should do that. And so I'm thinking, I don't know where we're going to get the money from this at, but maybe I can buy one more bike and he'll be happy. So we bought one more bike, and we bought that bike to address a lot of things that happen to veterans. When we're put on certain medications, it causes us to gain weight or we can't be active again. So we wanted to have a mission critical bike for a veteran who was on the heavier side that could ride. So we got a bike that could hold 350 pounds and was easier to get in and out. I think I hit this. Okay. So that's my husband. I won't go into any more details about him, but he is my greatest inspiration as well. When we first started, he was walking with a four-pronged cane, and he no longer needs that anymore. He still has the falling spells, but he's strong enough to catch himself, and that's really huge for him. But I lost my train of thought. Let me go back. Okay, so we got the bike, the mission critical bike for a heavier set veteran, and then it just really took off from there. We started to get more and more bikes. We moved to a live work in 2015, which is how we ended up in the city of North Las Vegas, which we now call home. It was something instant in the city of North Las Vegas for us that really resonated with us, and we decided that's where we were going to really put roots. And from 2015, we just started meeting veterans in the community. They started what's called the Veterans Community Commission at the city of North Las Vegas. We participated heavily in that, and they were at some of our very early Veterans Day parades and different things that we were in. Moving forward, we were actually outgrowing that place. We were maybe up to about 20 or so bikes, and so we had started looking for other places, but the landlord decided he wanted to sell that place, and the one that we were in was for show. And so we went to look for another live work because we were really passionate just about helping veterans at that point. And God had other plans for us. We were able to find a Marine veteran who was on the VCC, actually, and he helped us move into a home. And this is what I know, and I know so much now. Having a home, a place that's your sanctuary, where you can go and really let your hair down, causes tremendous growth. I thought we were doing well at that point, but when we got our home, that was ours. It changed a lot of things with us, and we continued to grow. We thought since we had a home, we wouldn't be able to continue doing Forgot Not Gone, so we wanted to take a break, but we just kept getting bike after bike after bike, and luckily for us, it's a horse property, so we were able to house all those bikes in the back. And just fast forward a little bit, in September, we opened up our brick and mortar. Again, we are involved in suicide prevention. We had the grand opening on World Suicide Prevention Day. And what we've learned over these past 10 years is that none of us have the gift of talking somebody off that ledge or talking to someone, even if they do give you hints. It's being proactive. I realized if I hadn't have been separated from people that I called family for 10 years, just flopping around like a fish out of water, it would have been better for me because I would have had people who counted on me, who depended on me. Being in the military and then not being in the military is not going from one job to another job. It's really a way of life. Eat, sleep, and drink it. I have 3 veteran women that reside in Las Vegas that I've known for longer than my husband, for over 26 years. And it does not change. I pick up the phone, whatever I need, they're there. And I realized that that was family. And so we've just recently been cleared at the warfare level for resiliency program, which is their suicide prevention for Creech and for Nellis. We're going to do Military Mondays with them. And Creech leadership just came out and rode. And again, now we have about 70 different sports adaptive bikes. Anything that you can think of, any excuse they could possibly have, we have those different types of bikes. So those are our 3 tiers, emotional, and then spiritual and physical, of course. Let's see. Thought we had the videos in here, but I guess not. So we'll just skip that. But anywho, so the Creech, their leadership came out and they rode with us, and it was comprised of like 3 chaplains, 2 of their physiologists, like all of the leadership there, and just to be able to see them really dig into what we do. They had a young man who, he was on his way to work at Creech and he was hit by a car. He's 22 and he no longer has the use of his legs. Well, his first sergeant found out that they were cleared to come see us and they just came on their own. We have a hand cycle that is very expensive, but we have 4 of them. And to see him get on that hand cycle and now be completely independent, where he can ride himself, he can stop, he can start. There's a little trigger on it where even if he's tired for his arms, he can just press the button. And seeing him interact with his girlfriend, who's also 22, she said this is the first time he smiled since he had that accident. And it's just things that we take for granted, having that wind on your face. And so we wouldn't change anything for any reason what we do. Pretty much that's it. I mean, there's so much more, but I don't know what to cover at this point. So do you have any questions?
Thank you. Committee members? Vice Chair Brown-May.
Thank you. Thank you for that great presentation. So I have a road bicycle. I'm a road cyclist, and I love what you're doing. I think it's really great work and supporting the veteran community. Can you talk to me a little bit about how you are funded?
Yes, ma'am. So initially we were funded from Peter and I's retirement. But seriously. And then grants, donations. We did buy the majority of the bikes. In November 2022, we actually was awarded a $1.6 million grant from the city of North Las Vegas. And although we present really well, that money was for our infrastructure. And so now we have a almost duplicatable entity that we have. So we can go somewhere and duplicate. Part of that was to do jobs, and we have a phenomenal staff of disabled veterans and some of their spouses who are all caregivers as well for their spouses and for children, which I think most women fall under, not out of choice most of the time. And we have a trike side, which we do trike tours with different trikes. So we're dealers for all the trikes that we sell, and it is a store. So pretty much on the right side of our store is all the veteran nonprofit where they can come, military, active duty, and their family and friends, even when they're not there. Once we have membership cards, some of our members have their families come and participate in all the things we offer. We have stationary trikes as well. We have what's called compression sleeves. UFC fighters and NFL people use it, and so it helps them with a lot of rehabilitation. We have one member who's in LA now having spinal surgery, and she's like, I can't wait to get back to start using the compression sleeves again. We have 4 sets of those. And so the other side is the trike life side. So that side just feeds that, so we could become more self-sufficient. But mainly it's going to be grants and then our trikes and tours side.
Thank you. And then just one last piece. Being on the road, right? I'm assuming you're out on the road and cycling. Do you have set routes that you go? Where do you, when you're out on a ride, where do you go?
Oh, absolutely. Is there a way, Destiny, to get to YouTube or to show the video on here, or? Because that's an excellent question, and the best way to see it is to really see it in action. But we do ride on the trails. Contrary to popular belief, City of North Las Vegas has wonderful trails. The 215 just opened up, and it is the best scenic view you have ever seen. It is amazing. And we pretty much follow the lower Wash Trail. So right where our shop is situated is on West Craig Road. You make that right. That first right is Valley. Valley goes down to Tropical. From Tropical, we enter onto the trail, and then you're in Craig Ranch. You're on that lower watch. It goes all the way to Craig Ranch, around the Garden Reserve, Army Garden Reserve, who we ride with them as well. And then you're safe. You're on the trail. I find that to be a more pleasurable experience for my veterans. Some of them are a little bit, car shy, and some of them have TBIs, which is why they ride our bikes, because of the three trikes, the stability. So loud sounds and just cars in general bother them. But right from our shop to there, it's a straight shot, and then we are protected on the trails, which we want to build a establishment for ourselves so that they never even have to leave our property, and they do feel safe to go around on different things we have. Okay, okay. All right. Oh, for later. Okay, gotcha. Yeah, they're just really specialized bikes, and we do go to Red Rock. We ride at various different places, but we try to stay on trails just because of what you said. But there are a lot of places and a lot of bike lanes in the city of North Las Vegas and the surrounding area. We love Bruce Trent Park, too, at the city of Las Vegas.
Thanks. And just one last question. How long is your average ride?
About 2 hours, and it gives or take. But the thing I'm most proud of is that most of our bikes have electric assist. Heading back to the caregiver, we have something called a Yumi. And it was developed by a gentleman whose wife was very, very active, and she was paralyzed, and she wanted to ride again. So it's a tandem where you can ride side by side or forward and forward. The person on this side doesn't have to do anything. This person does everything. And so I always thought we had really unique bikes, because I would see people come out with we have dedicated carriers for dogs and for children. But I was hit with vestibular issues, not this October, but last October, where I was spinning. I thought I was having a stroke. It was really bad. I had to walk with a cane. I couldn't drive. And I was at home for 2 weeks, and they told me not to do anything, just wait till the spinning stopped. And I was so depressed. And I told my husband, I was like, look, you gotta take me for a ride. You gotta do something. And so when we got on one, we have 2 of those. When we got on the tandem and he was riding, and I felt that on my face and the sun, I was like, oh my goodness, this is mission critical. This is what we purchased this bike for, which is an $18,000 bike. And most people would be like, that's too expensive, but we're worth it.
Anyone else, committee members? Oh, yeah. Assemblyman De Silva.
Thank you, Chair. Thank you again for your great presentation, and I know your organization really well. Pete is a good friend of mine, and I just want to thank you again for the tremendous work you do with the veterans community, and also everybody here who has donned a uniform. Thank you for your service. My question is this: so, what's again? It's more of a demographic question. So, what's the oldest member of your organization, or who's participating in your organization? How old are they, and the youngest as well? What's the age range there?
I love this question. So 3 years old for the youngest. And then, like I stated before, I am in recovery. So it's always been a dream of mine to be of assistance to recovery houses and sober houses. So we do consistent rides free of charge for the veterans of those groups. And one of our groups is Lionheart Recovery. And I had the awesome pleasure of riding with an 80-year-old veteran who had just decided to get sober. And talk about inspirational. He told me when we were on that ride at Bruce Trent Park, he said, Kelly, I realize I might only have 2 to 4 years left, but I made a decision that I wanted to remember those days. Even if it's just, a slight here or there, he said, I wanted to remember those days. And I thought to myself, man, how courageous to want to get sober at 80. And so that has been our oldest, and they were in the Martin Luther King Day parade with us, and I have him on video doing a dance break with one of my Trike brand ambassadors. He's now 82, because we've been doing that with him for a couple of years, and I mean, it's amazing to see a 69-year-old veteran get on a hand cycle and do 16 miles an hour. I mean, 16 miles. And we've had people who haven't ridden bikes in over 20 years. And the first time they get on, they can do that trail that I was telling the committee about is about 16 miles. So we drive there and we come back and they're like, I don't move. They're like, my muscles have atrophied and you have just got me out on a 16-mile. And that opens everything. It's such a mind-body connection that when you do start moving and your body does things that you didn't think you were capable of doing, your mind then starts to understand that it is possible to do things that it thought was over for it or incapable. We do a lot of education on supplements and things like that because, again, I was dealing with chronic pain and I had to have a new normal way of life. So after a while, they're just like, well, what magnesium are you taking, Kelly? What vitamin D? Because most people don't know vitamin D and magnesium deficiency can manifest as depression.
Thank you. So thank you for the presentation. I just have a quick question. I see Mr. Chalno here. So I know you do these for veterans. One of the things that the Alzheimer's Association does is respite care for caregivers. Is it possible to partner with them? You may have some veterans as caregivers, and that would probably help them as well.
So I was thinking about that too, Senator, when you brought it up in their presentation. I'm definitely going to reach out because, again, like I said, I'm a caregiver myself, and I know that I can go and neglect myself. So I was going to try to talk to them. We do a lot of things. You only have to be sponsored by a veteran. So sometimes I sponsor people of my own volition because that's my right. And we do help a lot of people in the community that are disabled, that are senior, that just maybe they had a son or a daughter or a spouse that participated. That moves forward. So yeah, I would definitely love to partner with them. And again, my Women Warriors program was really, really hard to get off the ground. For years, I was only able to ride with one other lady, Ms. Terry behind me, and I started my Women Warriors right after we got our grant, and it has just really taken off. And I just kept wondering, why now? Why now are so many coming out? And then there was an article that I will send Ms. Destiny as well in 2021 that our women's suicides are up 3-to-1 to our civilian counterparts. A lot of different changes. We are using weapons where we normally would use pills and things of that sort. We're leaving children behind where that would be a motivator to not do it. So it is a serious thing. And so I'm realizing the reason my Women Warriors has taken off, and I'm really proud of that and happy for that, is because there's a need. In one of the testimonial videos I'll send, the young lady has given me permission to share her story. We met her at Craig Ranch Park, and it was 6 of us, 6 ladies riding. And she was going to take her life that day. That was the last time she was walking her dogs. She had made a commitment that after she walked them, it was over. And she happened to see us, and she saw us all in green. She said, "You look like you belong together." And if I just cried in someone's arm for 30 seconds, it would be a long 30 seconds. She cried in my arms for 5 minutes, and has been my shadow ever since. And I'm really happy to have God to have placed me, to have placed us there for her to see herself. And that's really what she said. When I looked at you ladies, I saw myself. I saw another veteran. I saw, some women of color, and it was more than I've seen doing something physical in quite some time. And it almost like it shocked her brain. And she's been really digging in. We do a lot of different resources where we vet different people and handoffs. So I'm really happy about collaborating with them as far as caregivers and stuff like that. I see a lot of need for homes for women veterans. Just we don't get a lot of things for ourselves. And I was really sure that we had bikes specific to women and to the needs of our women. We get a lot of hand-me-downs because it's a male-dominated career field, being in the military, even though there have been women for quite some time.
Well, there's information that the SecDef provided about a week ago. The fastest growing number of veterans are women. Let me say this, and I think I introduced you all before the meeting, but I would make sure that you stay close to or get information or get a meeting with Dr. Mayworthy Thomas about housing. That's one of the things that I know for women veterans that could trigger a commitment to complete suicide.
Absolutely.
And the other thing that I would say is we had a bill, I think it was 2017, and the bill required Department of Veterans Affairs, or we call it Nevada Department of DVBA. It's Department of something, but anyways, veterans. So we required them to establish an outreach program to veterans who had been discharged under Don't Ask, Don't Tell. And so as you all, get more veterans, or even the ones that you have, if you can just spread that word to them, because it's mandated by statute, and they should have somebody in that organization. That's the only reason they live, is to make sure they help veterans who have that type of classification, because most of them have bad paper. And when they do, they can't access a lot of the programs. They can access your program, but they can't access other programs. So I would really ask that you, when you see somebody, tell them, what's your discharge status or whatever, in confidence or whatever, and make sure that they get access to the opportunity to upgrade their discharge. I know Tony Washington was there for a period of time, but that's very important. Okay.
So to speak to that, ma'am, I'm very proud of that. We do that, and we have had at least 4 of our members have it overturned. And kind of how I found out about it, we have community partners that wrap all of our vehicles and our bikes, and they had a veteran who killed himself, and he had 5 children at home. And we just happened to know his backstory, and it was because of something that happened that wasn't handled properly. And that's when it came on my radar that usually those instances where there's something some sexual type or something that's just not norm in the military per se, they're not handled properly. And I was finding out that these dishonorables or other than honorable discharge was because of that reason. And they never had anybody tell them, I have an avenue, I have a resource where you can get that overturned. We have one, she got hers overturning, and now she's 100%. And it was a struggle for her prior to that, and she didn't believe that it could be done, but we do go out of our way to try to find that out. Luckily for us, being a veteran nonprofit that's ran by veterans, there's not that gap in trust. So the minute they come in, I can usually get them to open up and tell me what they need by way of help. So that is really on our radar, and I'm seeking more funding so I can get people to have that as a specific area where they only look at that. Terry just got her master's in social work, so we're going to be offering a lot more things, and I will keep that in my purview for sure.
Thank you. Thank you. question? No? Assemblyman Gray?
Thank you, Madam Chair. As a veteran and the father of two young lady veterans, I really appreciate everything you guys are doing. It's a great program. I actually literally just got my bike back up and ready to start riding again here this week, and I'm back into a position where I can actually ride again. But I'm wondering, do you guys have any plans to expand to the north at all, or can we, how can we get you guys to expand? Because it sounds like a great program.
Absolutely. Thank you, sir, for that question. We do. We have a 24-foot box truck, and we do travel. We've gone to Los Angeles, we've gone to Utah, and we do plan on getting to other markets. We've had joint things with Mesquite because they do have a good population of veterans as well. And we're really excited about expanding. We would love to come up north to Reno, absolutely, because we've been following the programs that you guys have that are facilitated as well for the senior veterans. Super impressed and kind of modeled a little bit of our infrastructure on how you guys have been able to do things. And we ride every single day. We would love to make it up to Reno, and we do have plans to expand.
Awesome. On your next trip this way, can you guys please reach out to me to help advertise and get you guys out there, whatever we need to do to make it successful, and maybe get a groundswell of support up here to get you guys to have an expansion project up here full time.
Absolutely, sir. Thank you for that.
Thank you, Assemblyman. Senator Krasner?
Thank you, Chair. Thank you for your presentation, and thank you for your service to our country. You just said that there's a resource to get dishonorable discharged veterans overturned. What is that resource, please?
It depends on, once I hear their story, who I pass them off to, but I will make sure I get that information to Senator, the committee, so that they can pass that information on. It's my own vetted individuals that I use.
So I know I'm bringing up another topic that really belongs at a later agenda meeting today, but there are some issues where female military members get sexually harassed and even sexually assaulted by other members of the military. And when they report it, instead of something being done about it, they get retaliated against. They get dishonorably discharged. I'm not saying this happens all the time, but I do know of one case.
Yes.
And then they're dishonorably discharged. I just, if you could help me with this one answer, I'd sure appreciate it, please. Or if you want to text me and talk to me offline.
I will, but I didn't hear the end of the actual question.
Oh, I'm sorry.
What can they do about it?
Yes. How can they overturn when they are dishonorably discharged because they're being retaliated against for reporting sexual assault?
Mm-hmm. So there is a process that you go to. I don't know that process. However, I do have vetted resources out there, and that is what they do. And we have had 4 successful cases where they were able to do that.
Who did they go to? What did they? Was it a procedure?
It is a procedure. Yeah, it is a procedure, but I will make sure I get that information to you and the individual that does that, or that I use most often, so that they can walk you through that. Because everyone's situation is very, very different, but that is one of the things that is the cause of that dishonorable discharge, is because you decided to speak out, and because it was a supervisor, or for whatever reason, you in turn get retaliated against and get an other than honorable or dishonorable discharge. But there is an avenue and a way to go for that.
Thank you very much. Thank you.
You're welcome.
And I've just been provided the NRS for that bill is NRS 417.121, the requirement to have an outreach person.
Okay.
Nevada Department of Veteran Services, NDVS. I think I got it right.
Can you say it one more time, Senator?
417.121, NRS 417.121.
Got it.
Okay.
Thank you.
Additional questions? Assemblyman Gray, you have an additional question?
Yes, Madam Chair, just a point of clarification and some stuff regarding Senator Krasner's question. To clarify, a dishonorable discharge can only be given through a military trial, a court-martial. So that's going to be a totally legal process, but there are avenues which I can actually help you with also for individuals that have general, if they don't get the honorable discharge, if they get a general under other than honorable conditions or a lesser, I can actually help you with that process. I've been successful in several, but any characterization of service that's been granted by a military court-martial is going to be a full-on legal process, not just a correction process through the Board of Military Corrections. But I can help you with that if you'd like, Lisa.
Thank you, and I would, Assemblyman, I just ask you to get that information to the committee so we can have that available. And Ms. Guidry and you can talk. And there's some other women's organizations here too that will be coming up next, and that would be helpful for them. And let me just say this, I've been talking a long time about what we need to do with women veterans because we've not focused on women veterans. We build, accommodations, housing accommodations. They say, oh, well, women can come here. Women aren't going there. For precisely that reason, many of the women have experienced MST, military sexual trauma. That's just a nice name for rape. And they had no place to go, and so they're not going. So thank you for addressing that. And we've got housing coming up a little bit later. And I hope you all will stay around for that because that I know lack of housing and support like that also creates a dilemma for all veterans, but women veterans in particular. So thank you for your presentation. Okay. Yeah, so let me get She Served Sheroes up next, and Nevada Women Veterans, you all are on deck after her. Okay?
Thank you, Senator and committee. My name is Marquetta Oliver, co-founder of She Served Sheroes. I'm here with my partner who's seated as well, veteran advocate Latari Martin.
Excuse me just a minute. She can join you at the table.
Wonderful.
Yeah, don't be shy.
I would like to start with sharing a bit about my story. I'm glad that we're talking about women veterans, and each of us have our own story, and unfortunately, none of them are anomalies. For myself, I am one of the several women that did not know that I was a veteran. When the senator had mentioned how we ask people about their service and saying, have you served versus are you a veteran? I didn't know that I was a veteran until 10 years after I got out of the Air Force. I was discharged from the Air Force for refusing the anthrax vaccination. The year before, I was deployed to Saudi Arabia during 9/11. I was in Saudi Arabia before the 9/11 attacks happened. And I was then selected to be the enlisted aide for General Wald, who was the 3-star general that was running the air portion of the war from Saudi Arabia. Even though I had that experience in serving a 3-star general, a year later, when I was requested to be deployed and uncomfortable with the vaccination that was under investigation during my prior deployment. When I came back, I was also airman of the quarter at my base. I was then faced with being discharged. I was threatened with being having a court-martial, having that dishonorable discharge. This was the first time in my life that I had to result in community, tapping into community, and realizing the power-saving entity that community is. I was able to get a character letter from a politician back home in Los Angeles that in all essence saved me from getting that dishonorable discharge, and I was still discharged under a general discharge, but I was not court-martialed or banned from the base where my husband at that time and child lived. After I was discharged from the military, again, I thought that was the end of my service. I didn't even realize that I was a veteran. 10 years later, I was in a very toxic relationship that led me to being homeless. At that time, family members, community, again, told me that I was a veteran and basically dropped me off at the VA and said, go ask for help. During that time, I lost my job. I had two family members that died in close proximity. That was my first time dealing with death at such a close proximity like that. And I stepped down from my management position, again, was in a very toxic relationship, found myself without a career and without a home. When I was dropped off at the VA to basically go get help, I was introduced to all types of resources. And it was basically a janitor at the VA that took me under his arm and said, I'm going to show you which offices you need to go to. I was able to apply for HUD-VASH and receive HUD-VASH. This was the turning point in my life, and when I realized that my service counted. I am a recipient that was homeless, went through the HUD-VASH program, got back on my feet.
Can you VASH?
Absolutely. So there is housing for homeless veterans, like Section 8 is what they call it in the civilian world, but there's a program specifically for veterans, Veteran Affairs Section 8, basically housing. And so I was able to apply for HUD-VASH and
What does that acronym mean?
HUD-VASH, Veteran Affairs, I'm not sure. It's housing, I know for sure, but I don't know the exact acronym. But I was also able to benefit from like getting back on my feet employment-wise, using resources like Dress for Success to make sure that I had the right presentation for the new job that I got because I have the experience. I had a lot of management experience. I was just in a low point in life. Throughout the years, I've had to return to the veteran community, but it was from that point that just on my own, I really started trying to connect links. My mom likes to call me the connector. I've always been a person that reaches this person, and says, you guys should connect together. When I moved to Las Vegas 2.5 years ago because I was on my feet and ready to use my VA loan to purchase a home. We thought we were going to move here. I was in my second marriage. We thought we were the love of my life. We thought we were moving here to really plant our life and move forward in Las Vegas. 4 months after we moved here, I lost my husband to COVID-19. This was another time that I completely had to just turn myself over to resources and community to get myself together. At that space, I knew that I could not handle it. I've had too much on my plate, being a minority woman from South Central LA, raised in the 80s. I've always faced adversity. I don't know who my biological father is. I handle things and wear them well. But when I lost my husband, I thought I was going to actually lose myself. Because I knew that I didn't think that I would surpass that, I immediately reached out to Veteran Resources and dove into the veteran community. So for the past 2.5 years, I have been at any veteran event I could be at in the city of Las Vegas, while also figuring out who I was going to be in this world now that I did not have that partner. I was not in this life space that I thought that I was in and having to start completely over. I became a veteran career coach in Las Vegas for Goodwill. And it really introduced me to a lot of what was happening in the veteran community and showed me how much, again, that I was not an anomaly. I've had several veteran women that came to me that are minorities just to ask what to do next, whether it had to do with starting a business, with finding a place to live, finding clothes, or any gap that they may be facing. Because like we have talked about already, a lot of women military members have faced military sexual trauma. And when we talk about the 1 in 4 or 1 in 3 number that is currently reported, these are women that are actually connected to the veteran health care services. So all of these women that will not even get any services or will not connect or don't even know that they're veterans, we don't know what that number looks like. And a lot of times they're not willing to go to the veteran, to the VA. They want to talk to someone that they know, someone that they feel comfortable with. So fast forward a bit. I've worked with a lot of veteran organizations. I have a for-profit company, my partner and I, Latari, do. And again, we're focusing a lot on the needs of minority women veterans. We were in a program with Bunker Labs because we know how important it is to partner with larger organizations. And while we were going through this business incubator class, we birthed She Served, She Rose. The goal of She Served, She Rose is to be a standing veteran service organization. When you think of other veteran organizations that are on a national level, that is our goal for She Served, She Rose, with the primary objective of catering to minority female veterans, because there are a lot of resources that we feel disconnected from and we feel unseen. We launched She Serves Sheroes just last year, last quarter, as a podcast in order to start getting the word out, one, and two, to start receiving stories of minority women veterans. We ask all of these women about their service, about what they do today in the community or in their own business to provide their business as a resource to the community. And we also ask them to share resources that other veterans may not know about. Even though we have a weekly podcast, we've also been attending veteran events like the NDVS Women Veteran Conference, where we're doing spotlight interviews, where we're asking women again about their service, but just in 2 minutes, what they do today for the community or in business so that we can share what they're doing. And three, to please provide a resource that they think every woman veteran should know about. We did that here at NDVS just last month, and we just did it in Dallas for the IVMF, Institute of Veteran and Military Families Veteran Edge Conference held by Syracuse University. We were able to interview about 25 women at each of those. We've interviewed about 20 women on our podcast so far. And again, this was just to start building our resource catalog, building our community of women as we work towards our nonprofit status. We received our nonprofit status last month as well. Again, because we are trying to really get the word out there about She Serves Sheroes in the community that we are trying to make sure knows about the resources that are presented today and throughout the country. We've been partnering with larger organizations. So we'll be hosting our first in-person conference April 27th under the umbrella of the Women Veteran Alliance, which is a national women organization for veterans. This conference will be held in 14 different cities at the same time, with 3 keynote speakers being streamed throughout the country. In Las Vegas, She Serves Sheroes will be hosting this conference to, one, connect women veteran, and two, to empower them and actually give them tangible resources that they can take with them to the next level. Our conference speaker is someone that is a Navy veteran, and she is big on helping startup businesses find grant funding, and that's pretty much a lot of her mission. So at this event, we'll have tangible resources for women. We're also having a Friday night event the night before, which is a wellness fair, just so the women can connect, and again, the importance of moving the body, not isolating. So they'll be able to do things like draw mandalas, have a hula hoop class, not like the waist hula hoop, but like dance fancy hula hoop they do now. And we were able to get that sponsored by a local veteran service organization as well. And we've partnered with a couple of service organizations to provide online workshops. Thank you. Online workshops on different topics like starting your business, how to present your online community, how to develop your personal brand, how to attain grant funding. We're also working with different community partners and working for grant funding to be able to provide employment opportunities and tracks for women. Again, I came from nonprofit, so I'm very familiar with grant funding and how to get professional certifications for women. And so we're trying to work with Renewable Wind Energy. We have a partner that's a veteran-owned business. We're trying to get women into trades, women into technology, and starting up entrepreneurship. We saw that there's the AB 306, and we're interested in supporting bills like this that would make sure that women veterans who are starting their business don't have to pay out of pocket for their business license initially, but making more of these type of things more accessible for women veterans, especially those that are starting in business. We have found that I can't give you the statistics, but a lot of the women veterans that we talk to, if they're not community leaders, they are in business of their own, and we want to really supply those resources. We've tried to also partner with other community partners so that we can start providing computers and things like that for startups. We're looking to support bills that focus on economic empowerment for women, transition assistance, diverse perspectives for helping women veteran entrepreneurs, and really supporting the networking and connecting for any step of life that a woman veteran may be encountering and needs help with. I generally talk really fast, and I know I was speaking fast, but I think I'm going to pause to see if there's any questions.
Committee members, questions? Senator Krasner? Senator Gray? Okay.
No, ma'am.
I'll have some at the end. Okay, yeah, you got a question? Okay. Don't leave. Yeah, yeah, I'm going to, some information for you and for Forgotten Not Gone. So in 2017, we had the bill, Senate Bill 141, that forms, state forms, instead of asking, are you a veteran, they now ask, have you served? And for your driver's license, you can get that designation if you present your discharge. It doesn't cost you anything if you're renewing your license, but I always encourage veterans to do that because that also is a way to identify yourself. So it's, yeah. Okay. So the information that you gave to us is a lot. How could we find a condensed version so that we might be able to share it?
SheServedSheRose.org.
Okay. All right. Thank you so much.
Thank you.
Okay. That's it? Okay. All right. Women Veterans of Nevada.
We're not breaking
There we go. To answer the question on HUD-FASH, that is the Housing and Urban Development, Veteran Affairs Supportive Housing, Senator.
Thank you, First Sergeant.
My name is Sergeant First Class Thompson, and I am retired Army. I am on the executive board for the Women Veterans of Nevada, and I am better known within the veteran and small business community as Sergeant Dixie. I have been a Nevada Veteran of the Month for my work supporting veterans. I mentor and support veterans and home-based business owners. I'm also the author of how-to resource guidebooks for women veterans that are useful for any veteran, but they cover the subjects specific to our women. I have provided a handout, so that will tell you more about the organization, who we are, and what we do. We were founded in January 1986, and we have continued to expand our membership and activities supporting not only the veteran community, but our local community in general. We support and collaborate with other organizations on projects supporting veterans. Many of our members have founded their own organizations to provide services that are lacking in the community. That includes Callie Guidry and Marquetta. Our president and several other members are present in the Vegas session. We do what we can to support all veterans, but our focus is on women and the particular challenges that they face. Women veterans have been unrecognized and ignored for our small numbers in comparison to our male counterparts. The number of women veterans is growing rapidly as the cap on the number of women who are allowed to serve has been removed. Some of those challenges facing women veterans include dedicated affordable housing, transitional housing, housing that is co-located with male veterans is detrimental to the mental and physical health of our women veterans. They suffer assaults, to include military sexual assaults, or as Senator Spearman said, rape. While not all women have suffered trauma, there are still male veterans who will prey on them if they are housed together. Most veteran transitional housing also does not allow for dependents to be housed with them. And I'm currently working with 3 organizations that are establishing separate dedicated housing for male and female veterans with and without dependents. The number of homeless women veterans is hard to determine as the statistics are usually 2 to 3 years out of date. The fact that many women do not self-identify as veterans. Their reasons for not believing they're veterans may be that they do not leave the United States, They did not deploy to a combat zone. They did not retire, or they just feel that whatever they did in service was not important enough to qualify them as veterans. In some cases, they are even ashamed that they have not been as successful in their civilian life after military duty as they were in the military. Other challenges facing women veterans are the lack of job training or the ability to translate their military experience into civilian job specialties. Some job specialties within the military do not easily translate over to civilian careers, and they need help with that. Access to benefits, whether from the VA or the Nevada Department of Veterans Services, is difficult for women to use because they don't know what they have earned with their service. They don't know who to talk to. This is one of the most important pieces of information that women veterans in Nevada publicize to the public, making women veterans aware of the resources that are available to them. The availability of daycare while they further their education, job hunt, work, or receive health care is lacking. Divorce is not unique to the military, so many women veterans are single parents with one or more children. There is limited access to health care and especially access to dedicated women's health care facilities. Going in and out of the VA, they may be harassed by the male veterans there, getting to speak with mental health providers who recognize that not all trauma is military sexual trauma related. And it is not less relevant because it did not occur in a combat theater of operations. Women veterans are becoming more educated about what they have earned with their service, and they are refusing to be invisible. It is the job and obligation of our legislature to support them in obtaining the benefits and services that they have earned and that they need. That's really about all I have to say. If anyone would like to contact me personally, you can get hold of me at sergeantdixie@gmail.com. That is Sierra Golf Tango, Delta India X-Ray India Echo @gmail.com. And we partner with many of the other organizations, as I said, so that we cover everything. And in June, I will be up in the Reno area for a barbecue just for women veterans to spread the word and help them join our group. Thank you.
Thank you, Sergeant Dixie. Any questions? Senator Krasner, question? No?
Thank you, Chair. Yes, thank you very much, Chair. Sergeant Dixie, thank you very much for your presentation and thank you for your service to our country. I would like to contact you. Is it sgtdixie@gmail.com? Did I write that down correctly?
Yes, ma'am.
Thank you very much. Have a wonderful day.
Thank you.
Additional questions? Okay. Seeing none, Sergeant Dixie, thank you so much for your service, and even afterwards. There is one program that you didn't mention. That was the one that you all started, I guess, about 7, 8 years ago, Life After Active Duty.
That is now Veterans Life Services, and yes, we partner very closely with them. We support them and the Fisher House with donations each year, as well as volunteers.
Thank you. Thank you. And so with that, I want to thank everybody, all the women veterans organizations. I don't know when we've had this much representation in a committee, and the words that you all said, the information that you all have given will move forward, and it will help enlighten more people about the service that women have given and the sacrifices that they've given. We have a program also with Veterans Court that deals with MST, It was a bill that myself and Senator Joyce, just lost her name, Woodhouse, Senator Joyce Woodhouse sponsored, and so make sure your folks have access to that too. Okay, thank you. I invite you all to stay because there's some more good information coming. I think we have now agenda item number 6, Dr. Worthy Thomas from Nevada's Housing Division, and you're presenting on the account for affordable housing and some pilot programs that you're working on. Thank you, ma'am. Begin when you are ready.
Hello, I am Dr. May Worthy Thomas, Deputy Administrator for the State of Nevada Housing Division. I am very pleased to be here. Thank you for the opportunity to come and talk about our programs. I do have a presentation, a PowerPoint. Okay, thank you. And just to go ahead and get started, this was very inspirational, hearing all of the services that are being provided to these groups. And just a little background about the State of Nevada Housing Division. I know I'm here to talk about the account for affordable housing, but just a little background. We are a division of the Department of Business and Industry. We were established in 1975. We are considered the state housing finance agency. Our mission is to improve the lives and strengthen Nevada communities by expanding housing opportunities, building self-sufficiency, protecting the residents and industry of manufactured housing, and by fostering economic development. And we do have 47 full-time employees. And just about a little bit about what we do. Our agency, we touch the lives of 1 in 4 Nevadans through our programs. And some of those programs, besides the Account for Affordable Housing Trust Funds, are our homeownership programs, production and preservation of multifamily rentals, our state and federal grants, and we also have oversight of the manufactured housing compliance, weatherization efficiencies, as well as being a resource for economic data. And so in being here today, and I thank the Senator for the foresight to invite us here to talk about these programs, in particular the state trust funds, which I'll get to, but in listening to all of the services and wonderful work that has taken place for our seniors and our veterans, we touch the lives of all of those populations. Our programs that we're using state and federal funds to build housing for seniors. Veterans take advantage of those housings services. Our down payment assistance program, we specifically have a program for veterans who are interested in purchasing a home, and so we do serve that population in that way. Our weatherization programs definitely help our seniors and veterans and people with disabilities in lowering their energy bills so that they can maintain their home and be able to utilize their funds as efficiently as possible. And then we also, of course, we have oversight of the manufactured housing industry here in the state of Nevada. And so we have numerous seniors specifically who live in our manufactured housing, and we ensure that that housing is safe and affordable for them as well. And so the account for Affordable Housing Trust Fund, that's what I'm here to specifically talk about today. Just a little background about that. That is formally known as our Low Income Housing Trust Fund, which was established in 1988. 89 by NRS 319-500 in our regulation NAC 319-885. And HUD provides home funds. It's a special grant that we receive from the federal government, and they require that our jurisdictions who receive those funds have matching funds. So the account for affordable housing was started so that they could have funds to provide that match. So that's a huge source for our jurisdictions who all receive these home funds from the federal government, including the funds that we receive here at the state. And the account for affordable housing, it is funded by proceeds from the real property transfer tax, and we receive 10 cents for every $500 of value from that particular fund. So just to share a little bit about how the funds are used. Specifically, any program that receives these funds from us must benefit individuals who are at 60% of area median income. We also have an allocation per the NRS, and this particular list comes specifically from the NRS that guides us in how we are required to use these funds. So we have an allocation for NV Housing Search, which is a database of all the low-income housing that is available here in the state of those multifamily housing programs and services and that are provided. And then we have the lot rent subsidy for manufactured housing, again, for people who live in manufactured homes, but they're having a little trouble paying their lot rent. A misnomer is that if you live in a mobile home, you own the land, but really you don't. You're renting that lot, and we can provide a subsidy to help individuals with that. Then we have the welfare set aside, and we give an allocation to all of our counties, and that is used pretty much for emergency rental assistance, utility assistance, deposits, and things like that. So that's another allocation that we have there. And then we use some of the funds as well for some of the affordable housing projects, multifamily projects that are being erected using federal tax credits. And then we have our jurisdictions. We give them those funds as a match, as I mentioned before, and that's specifically written in the NRS. And then we have projects that receive a commitment from local government. So a lot of times projects that are developers who are interested in building housing will go to our local jurisdictions and ask for an allocation, and they will receive that there as well. And then we have our new construction projects as well, our projects of rehabilitation to keep some of those projects, those particular multifamily housing units up to par. We want them to maintain livability as well. So those funds are sometimes used for rehab as well. And then we also provide some funds to organizations that help to rehab single-family homes, because as you know, that's an important area as well, helping people maintain their homes where those homes are livable and not falling apart. And then we have other special projects. And then we just added, thanks to the senator, we added in 2023 session through SB 363 that now when we are allocating these funds that we give a priority to support projects and services that support women veterans, women seniors, women who are formerly incarcerated, and unmarried persons with primary physical custody of a child, and women fleeing domestic violence. So how are the funds distributed? So these funds are distributed through using a formula. We calculate percentages for each required set aside. And so we each year that changes. And each county is offered an allocation based on their population. We look at what the new population figures are for the year, and we calculate that. And counties do have the option to accept or decline, but they do typically accept. Some of our very small counties only get a very small allocation, and they may not always accept. And then after the statutory priorities are calculated, remaining funds are opened up for application, and that's a competitive round where different developers will bring a project to us, and we will allocate those funds on a competitive basis. And then we also use these funds for special projects or needs that may receive funding throughout the year from perhaps the discretionary set aside or the administrator set aside. Our annual allocations. So this just gives you a little snapshot of about how much money we're receiving each year. This amount does fluctuate, as you see. So coming up this particular year, we just opened applications, and so we have about 8.5 million available. In 2024, we had a significant amount more. We had 13.8 million. And then in 2023, about 10.4 million. And then in 2022, we had about 7.7 million. So just to give you a little snapshot about how we allocate those funds. We have not allocated the 2025 funds yet. That application process is still ongoing. So I'm giving you a rear look at how we spent the funds in 2024. So this is how those funds were divided up. The NHD discretionary, about 1.3 million. For administration, basically payroll, admin, any of that type of work is about 180,000 that we take per the NRS. The housing database, which is NV Housing Search, we give 175,000 per year. That's a set amount, and then our a lot rent subsidy program that I mentioned, we give about 75,000. That is a set amount each year. The administrator set aside is 750,000, and that is a set amount. And then these other funds are calculated by percentages by population. So last year, our welfare set aside, we divided up about 1.6 million among all of our counties. And then our local share by population, we give a share to these larger parts of our state. So we have Clark County getting the largest share at 4 million. Then the city of Las Vegas getting about 1.9 million. Henderson getting nearly $1 million, and then city of Reno getting about 1.4 million. And then after we divided all of those up and gave everyone their particular share or calculate through calculations, we now have the leftover to do competitive grants. And we're able to do quite a bit with that competitive amount of money. We did have a little bit more last year than what we'll have this year, but this is just a list of some of the competition that was provided through this process. We gave like about For Carson City, about $90,000. That's Health and Human Services. And then about $7,500 to another nonprofit. And then Churchill County requested funds at about $20,500. And then Crisis Intervention, which is a domestic violence nonprofit, received about $29,000 to $30,000. Then Douglas County, we gave an allocation of $70,000. Elko, about $10,000. Lyon County, $80,000. Nation's Finest, which is a veterans service organization, did receive $95,000. And then the Nevada Rural Housing Authority received about $400,000, and Nye County, $15,000, and Washoe Housing Authority about $233,000, and Winnemucca Domestic Violence about $28,000. So our state fiscal year applications just opened up, and the deadline to apply for those applications is June 10th, 2024. We leave those open for about 90 days. And then we have about less than $1 million this time for our competitive applications. And then for our SB 363 priorities will be considered in evaluating these applications that we receive. And so then we have our discretionary administrator set-asides will be available throughout the year. So those projects and services don't have to wait for the application process. They can submit a special request to us to be considered for an allocation. And then in particular, I know this is of special interest to the senator. I did send out a special notice to some parties, interested parties, announcing the addition of SB 363 into the NRS, and that those particular populations were going to receive special consideration. So just did a little bit of outreach because that is new. And we typically serve the same organizations, so those organizations would not be aware or may not be aware of this new priority that we are placing. And we did, as I mentioned before, those particular populations being seniors, reentry program providers, domestic violence service providers, veteran service providers, social services agencies that receive housing requests from single parents. And those are just a few of the interested parties that we did purposely reach out to share that we were providing this priority. And this is just a public notice that went out, just so you can see what we shared with everyone, letting them know about that that new list that we were adding, and that we really wanted to let them come to us, and we want to even provide mentorship to some of them, because sometimes managing these grants can be a bit technical and a little difficult. And so we want to specifically offer them our help so that they don't feel so daunted by the application process, and perhaps they are not in an operational position this year to receive funds, but maybe we can help them along and help them understand what their needs are in order to qualify for these funds and be able to meet the compliance and understand the NRS and what the requirements are. There are some reporting requirements. We do monitor these funds to see how you're spending them, to ensure that you are qualifying the recipients of your funds through making sure that they are, under 60% AMI. And so those are just a couple of the requirements that sometimes organizations may struggle with, ensuring that they are keeping up with the recipients of the services, specifically if they're living in these multifamily units that are ongoing, and they're living there ongoing, and so they are required to be income qualified. So that gives you a really quick overview of the account for affordable housing, and so I'm glad to take any questions.
Committee members, questions? Okay. Vice Chair.
Thank you, Chair. Thank you for the presentation. I appreciate the detail and the numbers in particular. You've really helped with my data brain this morning. I'm going to the slide that talks a little bit about the history of the account for Affordable Housing Trust Fund. And it says that it's 10 cents for every $500 of value in real property transfer tax. I'm curious to know, are there instances that we're not capturing that tax that would help us increase that fund? That's my first question.
Dr. Mayworthy Thomas for the record. Well, in this past session, there was attention drawn about where all of the different properties were possibly not paying into the fund as they should. And so there was an increase in how that is going to work. I can't quote that NRS, but there is an expectation that that fund will increase.
Thank you for that. And then secondarily, on that same slide, HUD provides the home funds to the state that requires a match. Are we maximizing Nevada's drawdown, right? Do we have access to the maximum amount of funds that are available to us federally?
Yes, Dr. Mayworthy Thomas for the record. Yes, we are absolutely drawing everything that is due to us. Those funds are provided to us by formula as well, nationwide. Each state is given an allocation down to some of the bigger jurisdictions. And so the state, we typically receive about $3 million a year in home funds.
Thank you. And then one last question. Do we have a number of units available? Are we able to meet the demand with regard to the number of units that we have available?
Dr. Mayworthy Thomas for the record. Unfortunately, no, not at all. We are not, we need about 80,000 units to fulfill the need for low-income housing.
Assemblyman Gray.
Thank you, Madam Chair. Just wondering, looking through this, I applaud you guys for what you're doing, but we've got an ever-growing homeless population. I'm not sure how it looks down there in Las Vegas, but up here, especially along the Truckee River and those areas, under bridges, along the train tracks. Just wondering, are you guys looking at doing anything for transitional housing or maybe dry housing where these folks could at least get a roof over their head and people can get them on their feet and move them into something more permanent? It just seems like that population's growing by leaps and bounds every day.
Dr. Mayworthy Thomas for the record. We receive from the federal government, from HUD, about $480,000 per year that we allocate statewide for transitional housing, shelters, excuse me, for shelters and homeless services. Each of the larger jurisdictions, they also receive an allocation of those funds, which is called the Emergency Solutions Grants. And then most recently this past year, we received a new grant called Home ARP, part of the American Rescue funds, and that was about $6.4 million that we are allocating specifically for populations that are in danger of homelessness or fleeing domestic violence. But that particular grant also focuses specifically on homelessness, but I would absolutely say no, we do not receive near the amount of funding that we need to tackle the homeless population. Of course, our housing authorities, they focus on Section 8 and getting folks into housing. And of course, we have all of our nonprofits who have shelters, and they receive funding from various sources. And with the small amount that we receive, we try to supplement as much as we can for those particular programs, specifically street outreach. Some of the nonprofits do go out and specifically look for individuals living on the street to help them out, to at least get them some sort of shelter.
Thank you for that. Additional questions? I only have one. It's real simple. The information that you've given here, is it possible to, even if it's a Zoom, to set up some type of a workshop for the organizations that were presented today? And maybe there are others that help veterans, but I'm interested specifically in women veterans because those are the ones that are most underserved, just to get the information out, and especially the grant for 2025. And for those organizations who are here today, I would encourage you to get this information because you're probably working with some people who, if they don't need it now, they probably will within the next 30 days. So.
Dr. Mayworthy Thomas for the record. And yes, we actually have a workshop tomorrow. And I did take the cards of the two of the presenters to specifically share with them that contact information. But I've also offered my time to sit with them if they are unable to make that workshop to talk specifically about that. And we do make ourselves available for questions specific to how to access the different funds and programs that we have.
Thank you. Assemblyman De Silva.
Thank you, Chair. And thank you again for your presentation, Dr. Worthy Thomas. I just had a very quick question. Are there any nonprofit partner organizations that are also helping you do your work that we should be aware of, that we can also maybe reach out to potentially as lawmakers? Thank you.
Dr. Mayworthy Thomas for the record. All of our sub-recipients, there is quite a list of sub-recipients who we consider our partners in this process. As a housing finance agency, our specific mission is to be a pass-through for funds, to get those funds deployed to the organizations that then can get them directly to the residents who need those particular services and funding. So we're always open and welcoming of new organizations who want to receive funds that we have and partner with us in doing the work that we do.
Thank you, Madam Chair. Thank you.
Thank you, Assemblyman Gray.
Nothing further, ma'am.
Okay. Thank you. Thank you, Dr. Mayworthy Thomas. This has been quite helpful. And I want to thank you, too, for working with me last session to make sure we had 363 tight and right. So thank you so much.
Thank you for having me.
Okay. Committee members, if we can just kind of power through, I think we have a couple more presentations, and we'll do that. Okay. Yeah, and I'm gonna turn the gavel over to the vice chair right now. Just excellent. Yeah.
Say it again.
7, right?
7. Okay, let's move on to agenda item 7, presentation of a report relating to the awarding of contracts. And so I believe we have presenters, Will Lewis and Brian Walker, Deputy Administrator of State Public Works. You may begin when you're ready.
Good morning. I am Administrator Will Lewis, State Public Works Division, and along with me is our Deputy Administrator Brian Walker. Thank you for the opportunity to present this afternoon or noonday. Slide 2, please. Yes. Along with covering the introduction, I'm going to give a brief overview of the State Public Works Division, and Deputy Administrator Brian Walker will cover the details of how we qualify contractors to be able to bid projects through Public Works. And we'll also cover how the veterans' preferences fit into that process. In this particular slide, the language is taken from the NRS and the legislature. It acknowledges that the planning, construction, and maintenance of state buildings are a very specialized, complicated, and expensive undertaking. Based on that, the state legislature declared that all planning, maintenance, and construction of buildings for state use are to be performed by the State Public Works Division. In this slide, as an overview, the team responsible for planning, constructing, and maintaining all state buildings consists of the following. The administrator, myself, I'm responsible for overseeing all of the functions of the division. The State Public Works Board, which acts as a policy board, they assist us in developing our capital improvement program. They also provide approval of our regulations, and they help mediate contract or contractor disputes. Next, the State Public Works Division Professional Services section is comprised of architects, engineers, and other professional staff that help develop our capital improvement program and manage all approved projects. The State Public Works Compliance and Code Enforcement section is the building official functions. They are responsible for permitting and inspecting construction on all state properties. And last but not least, certainly, is the State Public Works Building and Grounds section. This department is responsible for maintaining all buildings and grounds assigned to them. B&G, as we affectionately refer to them, is also responsible for managing all commercial leases of state agencies. We're all governed by the NRS statutes 341, 338, and 331. Next slide. The NRS 338 governs how the division and all other public agencies implement construction projects. It broadly defines a public works project, which includes construction, repair, or reconstruction of a project or building, and how projects are financed in whole or in part with public funding for any publicly owned infrastructure. When implementing a public works project, the division follows the NRS 338. The NRS 338 provides us with directions on when qualifying contractors or bidding projects, as well as implementing the veterans' preferences consideration. So a big part of what we do at State Public Works Division is no doubt governed by the NRS 338. Next, Deputy Administrator Brian Walker is going to highlight just a little bit of how we cover the details of the process. So Brian, please.
Good afternoon. For the record, my name is Brian Walker, Deputy Administrator for the State Public Works Division. Contractors must be pre-qualified to bid on our public works projects. If they are not pre-qualified, we will not open their bids. The qualification process is in essence a screening process to ensure that contractors have the ability to successfully complete our projects. It's also worth noting that our list is used by multiple public agencies to qualify contractors, not just state public works. We have two qualification categories for a contractor to qualify with. The first is $100,000 or less. The second is $100,000 and up to a multi-million-dollar qualification. This means that to bid public works project of let's say $250,000, the contractor must be pre-qualified for up to and over $250,000. Likewise, for a project estimated at $75,000, the contractor must be pre-qualified for at least $75,000. The under $100,000 category is a 2-page application, while the application to qualify for larger projects is much larger and more involved. However, the process to receive the veteran's preference on both applications is the same. The contractor simply checks a box on an application and then submits a veteran's preference form from our website. The process to qualify for the veteran's preference has been intentionally made as simple as possible. It's a simple 1-page form. The veteran certification form, again, a single-page document where the individual indicates that they meet the criteria shown here, meaning that the submitter or the business the person who submits is 51% of a business ownership. It's an actual business organized and engaged in commercial transactions here in the state of Nevada, and it's managed on a day-to-day basis by a veteran with service-connected disability, which also includes transfer of business to the spouse as needed. The percentage of the disability is assessed by Veterans Affairs, and we don't ask for backup or documentation of that assessment. That's something that somebody else does. Once the contractor is qualified with Public Works, their name is put on a list that is accessible on our website for other governmental agencies to use. If they qualify for the veteran's preference, the contractor is included in a separate list, which is also available for our use, but again, also for other government entities to use. Currently, we have 4 contractors listed as qualifying for the veteran's preference on our site. Once qualified, contractors can bid on public works projects up to the amount of their qualification. Our statute splits public works projects into informal and formal categories. Informal projects up to $25,000 require soliciting of 1 pre-qualified bidder. Projects between $25,000 and $100,000 require soliciting of 3 qualified bidders, and formal bidding is for projects over $100,000. These projects are publicly advertised, and contractors submit bids through our online system. Contractors must also comply with the submission of a subcontractor list. There are bid bond requirements, and they must be prepared to pay prevailing wages and follow the apprentice utilization requirements. These bids are opened publicly. In both informal and formal bidding, the project is awarded to the lowest qualified bidder. Here, how the preference is applied change based on the size of the project. A preference is applied on projects of $100,000 or less if a contractor is owned or operated by a veteran with a service-connected disability. A higher standard is applied to projects over $100,000, less than $250,000. On these projects, the veteran's service-connected disability must be 50% or more. The preference is applied by deeming the bid to be 5% lower than actually submitted for the purpose of selection. Also, please note, looking at this, that there is no veteran's preference for projects over $250,000. The State Public Works Division provides biannual reports to this committee and the Legislature or Interim Finance Committee, depending on whether we're in legislative session or not. The report consists of the number of contracts subject to the veteran's preference, the total dollar amount of those contracts, qualified veterans that submitted bids, contracts awarded to qualified veterans, and the total dollar amount of awarded contracts. So here's a summary of the last couple veterans reports we've submitted. So looking at this, you'll see a lack of participation by veterans on projects. It's pretty obvious. I'd like to remind the committee that projects subject to the veterans preference is actually a small subset of the work we do. Remember that the preference only applies to projects under $250,000, and most of our work, most of our contracting is above that amount. So just to illustrate that, if you look at the left column, from January 1st to January 30th, we bid 6 projects that are subject to the veterans preference. Overall at State Public Works, we bid 63 projects. The following 6 months, the right column, we bid 26 projects that were subject to this preference compared to 49 projects overall at State Public Works. With that, I'd like to turn it back to Administrator Lewis for concluding comments.
Thank you, Brian. I'd like to thank the committee also for the opportunity to present on this topic. And before I open it up to questions, I'd just like to say that we've done our very best to make the process of applying and qualifying for preferences for our veterans as easy as possible. And by no means are we saying we're done. We're constantly looking for ways to improve and to make the process even more streamlined. We didn't come to this committee meeting with any preconceived suggestions rather for the veterans contracting community. Rather, we came with a willing attitude and an open attitude towards the community and the committee and any other stakeholders so that we can better support our veterans contracting community. And so with that as a backdrop, I'll open it up for any questions you may have.
Vice Chair. And then Assemblyman De Silva.
Thank you, Chair. Welcome back. Thank you, Administrator Lewis and Deputy Administrator Walker, for the information and the presentation. I'm troubled at we have 4 qualified contractors. Could you just clarify for me that the qualifications of those 4 contractors is for the $250,000 less limit, right, as opposed to the higher limit? Have we pre-qualified those contractors to do larger, even though we don't have a preference for the larger contracts?
Brian Walker for the record. Yeah, thank you for that question. So when we qualify the contractors for the preference, the veterans preference portion of that qualification does not come with a limit of whether it's, under 100 or between the $100,000 and $250,000. Part of the preference or part of the qualification is we record the percentage disability for that contractor. And so if it's over 50%, they're eligible to, get the preference for $100,000 to $250,000. And then, if it's less than $100,000, it applies, without the percentage. These folks are also pre-qualified for bidding on all State Public Works projects. I'm looking at somebody on this list here that has a qualification list of $5 million, which is above and beyond the veterans preference, but they're welcome when we do see them on some of our other projects. It's just the veterans preference doesn't apply to those bids.
Thank you for that clarification. So one step further, even though we may not be awarding contracts based on preferential for veteran status, do we ever have veterans contractors win those higher contracts just competitively without the preferential treatment?
Brian Walker for the record again. We have had these contractors win some of these bids in the past, and I believe we do report on that we do watch when that comes in. It doesn't show up in the report because it's not subject to the preference, but we have seen these folks on some other projects.
Assemblyman Silva, and then Assemblyman Gray.
Thank you, Madam Chair. Just a very quick question. So when it comes to qualifying entities that are now allowed to do business with the state, if a if a business does receive a bid, it can be, you said, transferred to a spouse, regardless of whether or not the spouse is a veteran?
Brian Walker for the record again. Yes, that's correct. So the spouse does not have to be a veteran.
Thank you.
Assemblyman Gray?
Thank you, Madam Chair. Two quick questions. One, when was the last time these limits were looked at? I mean, they seem extremely low this day and age when you can't even really, I'd say you'd have a hard time, remodeling a public restroom these days for less than $250,000. Part two is I was following along during, I think it was Brian's presentation on the website, and I found everything else, but I cannot find the Veterans Preference Certification form anywhere on there. And I'm thinking maybe placing it somewhere up front, so people see it, know it's there, may help out a little bit. But like I said, I went through each tab and everything, and I can't find it anywhere.
Administrator Will Lewis for the record. Thank you for that, Senator, and we'll make sure we put that into our presentation. In regards to the numbers, you're absolutely correct. I can't give you a specific date, but we are governed by the NRS. I know we review that on every cycle, but to say when we looked at the dollar amount, I can't speak towards that as of yet, but we certainly will take a look at that. Thank you.
Thank you for that answer. And Madam Vice Chair, I'd like to maybe bring that up for possible consideration for legislation from this committee, that we take a look at those numbers and maybe making them larger to allow for more veterans to competitively bid for projects. I mean, I can't even say bigger projects because most projects are more than that amount now. So I think it'd just be a good thing to go forward with.
We can do that.
Sorry, Madam Chair. Sorry, Madam Chair. I didn't realize you were back. I thought it was still the Vice Chair running the meeting.
It's okay. That's all right. My ego is not inflated, so I'm cool. You have additional questions?
No, ma'am. That's all.
No? Okay. Thank you. So I guess I just have one, and perhaps they would qualify. We got this little train that's getting ready to come through here, and we also have, even though it's a private entity, we also have a ball club that's coming in and using, tax abatements, I want to say it's like $385 million, something like that. And so if do you all plan on doing any type of outreach to veterans? And sometimes the trades have, skilled trades have veterans in them, so that could qualify. But I'm speaking specifically about business owners, because a lot of times people are so busy making a living that they can't pay attention to this. So, just a thought.
Administrator Will Lewis for the records. I agree with you, Madam Chair. That is something that we're concerned with. When we look at the amount of participation from our veterans and the provision of this clause to allow them to participate on public work projects. I'd like to give you an example. We have a contractor that is only licensed, has a licensed contract to pour cement, to pour concrete. And unfortunately, we don't put out concrete projects on public works. So we know that there is an alignment issue between what we put out and what the contracting community are being licensed for. So we're cognizant of that. We're concerned with it. Obviously, we would like to bridge that gap moving forward so that we can be more inclusive. Thank you.
Thank you. Okay, with that, thank you so much. Okay, I appreciate it. I didn't walk out on you. I just needed. All right, so we are now at item number 8. Nope. Yep. That's right. Yeah. Item number 8, report relating to preferences in awarding contracts to veteran-owned businesses. This, yep. Okay. Someone's in Carson City?
Yes, Chair.
Okay. Please begin when you're ready. I don't see you, but they're going to put the camera on you eventually.
Good afternoon, Madam Chairman and members of the committee. My name is Gideon Davis. I'm the administrator of the Nevada State Purchasing Division within the Department of Administration, and I have with me today Homa Woodrum, who is the general counsel for the Purchasing Division. Similar to the Public Works Division, the Purchasing Division is responsible for solicitation of contracts for the state of Nevada. The Public Works Division that spoke previously is responsible for construction contracts, and the Purchasing Division is responsible for basically all of the other contracts. Supplies, materials, equipment, technology, and services are all within the purview of the Purchasing Division, and so we solicit an award, or agencies, individual agencies of the executive branch solicit an award pursuant to NRS 333, the State Purchasing Act, for those goods and services. The Purchasing Division, in doing that, oversees those, and as part of that, implements the veteran preference that exists within NRS 333, similar to how the Public Works does for their preference in 338. The difference for us is we do not have a pre-qualification process for vendors the way that Public Works does, because our types of goods and services that we solicit can vary broadly, and so there's often kind of a last-minute opportunity for vendors to participate, and having them pre-qualified doesn't work in that sort of environment. And so the request for the veteran's preference from a vendor being applied to them occurs during the bid or proposal process, where as part of their submitted bid or their submitted proposal, the vendor provides a letter on their own agency's letterhead that indicates they are a veteran-owned business, and then that can be considered as part of the preference for award. We have a presentation today, and I'm going to hand it over to Homa to give some more specific information about the veteran preference that exists within 333, and then also the other preferences that we have in the law and how those affect the applicability of the veteran preference.
Good afternoon, Madam Chair and members of the committee. My name is Homa Woodrum. I am General Counsel for Nevada State Purchasing. I just want to make sure, is our slide deck showing in Las Vegas? There it is.
I don't see it yet. Yeah. Okay, there we go.
All right. Thank you, Madam Chair. So as Administrator Davis mentioned, there are a number of preferences in NRS 333 related to our presentation today. They are provided for in statute, and they create an advantage for certain bidder categories. Just as a point of clarification, the bid preferences are not in any way related to the preferred purchase program. The preferred purchase program relates to supporting certain types of businesses that do various job training functions related to individuals with disabilities. So NRS 333.3351 relates to a preference for Nevada-based businesses. 333.3361 relates to veterans with service-connected disabilities. And then 333.695 relates to an inverse preference related to against bidders with a principal place of business out of state. So what we came here today to point out, and we do have our report later in the presentation, is that the way that Nevada has structured its bid preferences has a number of pitfalls that create actually no preference at all for our veterans with service-connected disabilities, because the preferences do not stack. So if you have a Nevada-based business bidding on a purchasing contract, whether it's for goods or services, they will receive the same preference. The Nevada-based business will receive the same preference as a veteran-owned or operated Nevada-based business where that veteran has a service-connected disability. So I'll repeat that the Nevada-based business preference nullifies the veteran preference. Therefore, there is no advantage when you have two bidders where one is a Nevada-based business and the other is a Nevada-based business with a veteran with a service-connected disability. The inverse preference actually harms Nevada businesses when they attempt to bid on contracts out of state. So in 2017, Nevada reintroduced the Nevada-based business preference. It had been removed in 2009 when the veteran preference was put on the books. And then in 2021, Nevada reintroduced its own inverse preference. And what I mean by that is that the Nevada-based business preference gives a certain percentage, 5% benefit to a Nevada-based business, but it also means that when a business is bidding from another state that has its own preference for its own state businesses, then we actually penalize them. So it is really important to consider the legislative history. We all know our legislature often works in an iterative process. Adjustments from one session had impacts on prior sessions, and those ultimately nullified the effect of the veteran preference. So I've included a slide which I'll walk through. How do the preferences work in practice? So on this slide, we indicate vendor A, B, and C offer to sell goods to Nevada agencies for $100 per item. Vendor A is based in Nevada and is owned by a veteran with a service-connected disability. Vendor B is a Nevada-based business. Vendor C is based in California. So they've all bid $100. Vendor A's price in terms of competition will be considered as if it was $95 because it has reduced the price by 5% in order to give them the preference. And that's our veteran-owned, with a service-connected disability, Nevada-based business. Vendor B's price will also be considered at $95 because remember, the preferences do not stack. And the veteran-owned business is on the same footing as the Nevada-based business. Vendor C, our California-based business, will be treated as if they proposed $105 per item. Even though every single one of these businesses actually bid $100, we do some different math in order to effectuate the preference. In services, it's not a pure price consideration. Nevada is tasked with seeking best value under NRS 333.140. So this is not limited to price. When we write our request for proposals, we detail other features or things that a vendor should accommodate in order to earn our business. So maybe a vendor with a higher price, but a better warranty or a better insurance policy to stand by their services might prevail, or a vendor who perhaps is more responsive to our request. So in this scenario, vendor A, B, and C offer services to Nevada agencies for varying rates and varied abilities to perform the work. In this hypothetical, vendor A is owned by a Nevada-based veteran with a service-connected disability. Vendor B is just a Nevada-based business. And vendor C is based in California. Each vendor score would be affected by the preferences. Vendor A and B, if their scores were tied, would stay in a tie. Vendor C would be affected by the inverse preference, but only to the extent that the scores make a difference. So you can imagine that in goods contracts, that 5% actually might make a difference. In services contracts, it's a lot less likely because we're looking at a number of other factors that represent best value for the state in terms of what we call the responsiveness of the vendor. Did they respond to our request for details? And their responsibility, which is their ability, for example, their references, their success in other projects to actually perform. So some additional considerations related to our bid preferences. For services, contracting, and procurement, having the skills to be responsive to the agency solicitation is a greater determinant of success in your scoring. And that's where purchasing always recommends more educational opportunities in order to increase getting those points that should be really easy to get in our rubrics. Did you answer the questions? Did you describe what you do? For goods, contracting, and procurement, the inverse preference hinders Nevada businesses as they seek to expand. Because if a Nevada business that produces goods is now trying to expand their business and sell their goods in California, their goods will be more costly because of the way that reciprocal inverse preferences work. And the Nevada-based business and the Nevada veteran with a service-connected disability preferences nullify the effect of the Nevada veteran with a service-connected disability preference while also harming competitiveness elsewhere because they get dinged by the inverse preference when they attempt to bid on out-of-state contracts. So this chart represents our report related to contracts, the number of state purchasing contracts that were subject to the provisions of the NRS related to the veteran preference. So we have in the first part of 2022, we have about 1,300. Through the second part of 2022, we have about 600. In the beginning of 2023 to June of 2023, we had about 600 again. And then for our reporting period for the second half of 2023, we had 271. And we indicate the total dollar amount of the contracts that were subject to these provisions, meaning ones that would have had related preference. And you can see those are sizable amounts of money that are being contracted. But then you can see that sadly, the effect for our veterans specifically is minimal. Related to the number of businesses owned and operated by veterans with service connected to disabilities that submitted a proposal and were awarded contracts. Because remember, they did not necessarily, if another bidder was proposing who was just a Nevada-based business, then they didn't actually benefit from the preference. It would only be perhaps if they were bidding against an out-of-state business. And then the number of dollars worth of state purchasing contracts that were awarded to local businesses owned and operated by veterans with service-connected disabilities. And I'll also mention that NRS 333 actually covers all of state contracting related to not just the threshold amounts that state purchasing lead solicitations, which is that $100,000 and above or $25,000 per fiscal year, but it also relates to requirements for what we call our agency-led solicitations, but purchasing doesn't have the pulse of those smaller dollar contracts and how they're implementing the veterans preference. They are required by law to be implementing that preference, same with the Nevada-based preference, inverse preferences, what have you, but purchasing only has the pulse on those procurements that we lead. So there may be other data about other opportunities that's out there that we're not able to collect. So we wanted to come to this committee. We knew that the news wasn't great as far as serving our veterans in terms of the goals of this legislation when it originally came forward. And then Assemblywoman Debbie Smith, later Senator Debbie Smith, brought the bill in 2009 and specifically wanted to give our veterans with service-connected disabilities a competitive edge. And that was on the books until 2017, when the legislature decided to reintroduce the Nevada preference, which nullified the veteran preference. And then in 2021, when the legislature opted to also reintroduce the inverse preference, which would count against out-of-state businesses, and by doing that, harm our competitiveness additionally out of state. And I would note that for federal contracts, these preferences are not permitted. Same with our our cooperative contracts where we join with other states or work with other states, because if you use federal dollars on a project, the federal government frowns on preferring one state over another. So what we wanted to do is suggest some options for the committee to consider. Remove the inverse preference and the Nevada-based business preference from statute. That would revive the true effect of 2009's veteran with a service-connected disability preference. It would also allow Nevada businesses, all Nevada businesses and veteran-owned businesses to be competitive in neighboring states, to not only continue providing great Nevada jobs, but then also increase their productivity here so that they can sell their services and their goods elsewhere. Or another option would be allow the preferences to stack. So you could have a Nevada-based business and then have a Nevada-based veteran-owned business with a service-connected disability, and have that not just be that 5%, have it be a 10% when it is a veteran. This would not address the harmful inverse preference, but we wanted to put that out there. And then obviously anything we can do to encourage outreach and education for any of our partners that are looking to work with the state. I always say we're a great business partner. We pay our bills. We're a balanced budget state. People should want to work with Nevada, and we always want to be welcoming the utmost in competition and best value for the state. So those are considerations that we wanted to offer the committee. But as Administrator Lewis also mentioned, we come open to your suggestions, your considerations of how we can better serve the goals of this committee. We have our purchasing website. We have Nevada ePro. If you are a veteran-owned business or any business watching this presentation, please sign up for Nevada ePro. That is where you will get notice when we post solicitations and opportunities for you to work with the state of varying contract values, including state agencies doing their own solicitations through our platform. And then we also wanted to give a shout out. We have a federal surplus program that helps businesses, especially including veteran-owned businesses, that includes for-profit or nonprofit businesses, to receive federal surplus. And there's some minimal fees associated with that, but there are great federal items being surplused that our businesses can take advantage of. And with that, we'd like to open it for your questions.
Committee members, questions? Have any up north?
No, ma'am.
No questions? Okay, thank you. I just have one, and contact our policy person so we can talk about those suggestions. Okay?
Thank you so much, and thank you for the invitation to come speak to you, and thank you for the committee staff and support.
Thank you, thank you. And with that, we are at agenda item number 9, presentation of housing assistance, and that's Nevada's Department of Veteran Services, and you're in Carson City. Please begin when you're ready. Carson City, begin when you're ready.
Hello, Madam Chair and Committee. I am Lisa Massell, the Deputy Director for Nevada Department of Veteran Services. Thank you for having me here today. I do have a presentation, and I will get it on the slide. Yep. So I was asked to come here and speak about housing assistance, and NDVS is a bit limited in what we can do for housing assistance, and so I kind of wanted to give an overview on how we work and how we help our veterans and our family members. So Department of Veterans Affairs is separated into 3 different sections. One, the National Cemetery Administration, the Veterans Benefit Administration, and the Veterans Healthcare Administration. Housing through the VA actually falls under the Healthcare Administration, and NDVS actually works more in line with the Benefits Administration as far as what we can directly do for veterans' benefits. NDVS works in different capacities based on what the needs of the veteran and the family member are. So with housing, that falling under Veterans Healthcare Administration, we would refer a veteran directly over to the VA Medical Center for healthcare or our community partners. But what we do in that aspect is we still help our veterans with their benefits. One of our goals is to make sure that all of our veterans get the benefits that they have earned, that they're entitled to, and one of them is with their service-connected disability compensation or veterans pension, which is for low-income veterans. What this does is it will hopefully help a veteran get on their feet and their family members and keep them out of a homeless situation in general. Some of the other limitations that NDVS has is healthcare eligibility. We can't determine if a veteran is eligible for healthcare, but we can guide them. We can help them fill out the paperwork, and we can help them generate their DD-214 or whatever service documentation they need to go to the VA and get that determination. We cannot help with education eligibility, but in the same aspect, we'll help them get their their personnel records. We'll help them get their DD-214s, and we'll help them with any paperwork that we can to help them work with a school or through the education line to get them re-educated to help them become productive members of society in whatever job they choose. And then with housing, we refer over to Nation's Finest. They're one of our community partners that we actually have a memorandum of agreement with here in Carson City, as well as in Reno. And down in Las Vegas, we work directly with the VA Medical Center and in Reno, and all across the state. Some of the other resources that we use is Nevada 211 and Catholic Charities as well. Some of the ways that we can help our veterans is with our veteran service officers. We're accredited by the VA General Counsel. We provide assistance for free. We assist with VA appeals. We assist with obtaining DD-214s, military and medical records. And we work with an organization called NVLSP, which is the National Veterans Legal Services Program. This is an organization comprised of attorneys who offer pro bono work for veterans and their families in certain circumstances. They assist us tremendously with discharge upgrades when our veteran service officers cannot do it on their own, or with appeals when it becomes to a point where a veteran service officer can't offer that legal expertise. We have an LGBTQ plus VSO in our Las Vegas office who actually works for us throughout the state, and we have a women's veteran service officer who also works with us throughout the state. Our veteran service officers are available to help in various capacities, providing outreach or just being available to assist veterans in claims initiation. We work with different organizations such as the ELKS and the VA healthcare system at various stand-downs so that we can directly work with our homeless or our at-risk veterans. If anybody needs assistance with getting a hold of a veteran service officer, that website listed on the PowerPoint is probably the fastest way, but they can also call our office or just go to veterans.nv.gov to reach out to one of our veteran service officers, and we're more than happy to help. NDVS also has 2 members that are on outreach specifically for providing information to our community all over the state of Nevada. We're more than happy to help in any capacity that we can. We work with women veterans, LGBTQ, Native American veterans, justice-involved veterans that are incarcerated, our Black and African American veterans, Hispanics, Asians, homeless, and at-risk veterans. We do go out to rural locations such as in Elko, Ely, Austin, and we now have a full-time VSO in Mesquite who will be finished with her accreditation here shortly and will be able to provide services in that area as well. Right now, we need your help. Only 37% of Nevada veterans are connected with the VA in some capacity. We need your assistance in making sure that veterans know that we are available. Ask somebody if they served, ask a family member, make sure their family members know that we're here. One of the ways that we help veterans get connected with their service is their claims. If we get a veteran rated at 100% service connection, they could be getting a compensation payment of close to $4,000 a month. What we need to do to get these veterans connected is to determine what their diagnosis is, what event in service they had, and make sure that there's a link between that disability or that injury and their service so that we can initiate a claim for them and do it right the first time so that they don't have to go through the appeals process. Some of the other benefits that we can assist with if eligibility requirements are met is aid in attendance, which helps veterans if they require assistance with activities of daily living. This also applies to spouses. It's not a large payment. It's roughly around $200 a month additional to their compensation, and it's not a standalone benefit. The veteran has to qualify for a service-connected disability or qualify for veteran's pension, which is based on income, and they must be a wartime era veteran. There's other special monthly compensation that's available for veterans that a lot of them don't know about. Some of them are for loss of use of a foot, for instance, pays an additional benefit. Caregiver benefits, which are a large benefit that could pay approximately $3,000 to a caregiver who's helping a veteran with their daily needs if the veteran meets certain requirements, which is a 70% service-connected disability rating. This is one we can assist with the paperwork, but we can't see what the status is of the claim is on that. We can also assist with helping a veteran get TDIU, which is not on this slide. What TDIU is unemployability for a veteran who can't work, which this comes right along the lines with at-risk veteran. If they can't work and they have a certain service-connected disability, we can apply for this and demonstrate to the VA why this veteran can no longer work and get them paid at the 100% rating and essentially get the veteran all the same benefits as a 100% service-connected veteran. Recently, the VA enacted the PACT Act on August 10th, 2022, and just expanded it on March 5th. What this has done is added various presumptive service connections that veterans can file for. Many of them don't even know. One of the conditions that was recently added was high blood pressure or hypertension for a Vietnam-era veteran who is exposed to Agent Orange. While many of these veterans are only receiving a 0% service-connected disability rating and they're not receiving compensation for it, it still gets them linked with VA healthcare. But the recent change to the PACT Act added healthcare for many veterans exposed to toxins in Vietnam and after 9/11 and during the Cold War. These veterans don't even have to have a diagnosis. They don't have to be ill, but it gets them connected with VA healthcare so that if the need ever arises, it's there for them. They may have healthcare co-payments, but again, it'll all depend on what their condition is, but it'll get them linked into that system, and then we can start getting them other benefits and help avoid them from becoming homeless. So with that, once we go through this portion, there are 3 different programs, and as was mentioned before was the HUD-VASH voucher. This is, as was mentioned before, the Housing and Urban Development Veterans Administrative Supportive Housing Assistance. This is basically rental assistance with case management and clinical services. What this does is the VA Medical Center can look at the veteran, help them get rental assistance, but then looks at them as a whole person and gets them the help that they need. Whether it be supportive services for education or readiness and employment or clinical care, including mental health. Another program that's available is the Supportive Services for Veteran Families. This is case management and again supportive services to prevent imminent loss of home or find more suitable housing for the veteran. And then the next one that's available is the Homeless Providers Grant and Per Diem Program. This is it's used to develop and operate transitional housing and service centers for homeless veterans. And then finally is the Domiciliary Care for Homeless Veterans Program. It's residential care for veterans with multiple challenges, illnesses, or those who need rehabilitative care at a VA Medical Center campus or outside in the community. There's free help for veterans that are homeless or at risk of homelessness. And this 800 number is the best number anybody can call. Anybody in the community, a family member, a veteran, a service member, or another veteran service organization. This would be the fastest way to get a veteran linked up to immediate care, especially if they need even just a hotel, a quick voucher, anything like that. They will get them started, and then they'll help link the veteran with the veteran service officer to see if there's any opportunities for a service-connected disability or to apply for the survivor's pension based on their income. That's all I have today, and I'm available for any questions if you have any.
Thank you. Very thorough. Questions? Councilman De Silva?
Thank you, Madam Chair. I just had a very quick question about the 37% number. That seems very low, you know. And my question is this: in your professional capacity, why do you think that number is so low here in Nevada?
Sorry. Lisa Massell for the record. I do feel that there's a lot of reasons for that. We still have a lot of veterans who will not identify as a veteran. Again, that service, asking people if they served, that's a huge question. The other part is, and I would say that this is probably with the older generations, a lot of veterans feel like if they apply for assistance for something, they're taking away from somebody else. And the other part is a pride issue, right? There's a lot of older veterans that are like, nope, I was raised to not ask for help. They don't want to do it. So sometimes we get a lot of spouses that will call on behalf of the veteran and kind of push them that way. And a lot of people, they don't know what's available out there to them, or they're missing a DD-214, and because of that, they don't come and ask for help. And we can help with all of that, all of it.
Yeah, thank you so much for those insights, and we definitely want to be of help in this regard as well. Thank you, Madam Chair.
Thank you. Additional questions? I just have one, and just a real quick one. Are you doing any collaboration with faith-based communities?
So we have a couple new outreach people and that's a big one. We also have our education and employment and our healthcare champion and our suicide prevention program manager, and we are working on more collaboration with entities across the board, nonprofits, including our local state entities, and faith-based organizations are right up there.
Thank you. Assemblyman Gray?
Thank you, Madam Chair. Major Mussel, it's good to see you again. For those of you that don't know, she and I both served together at the same time, same unit, and it's great seeing you again. And I just want to tip my hat to you guys. You guys do an absolute phenomenal job at the Department of Veteran Services. Provides so many resources to folks to access benefits, and you guys put on one heck of a legislative summit this past Saturday, and I was very honored to take part in that. And just wanted to say thank you guys, and whatever you guys need in the way of help, please don't hesitate to ask.
Thank you.
Thank you. Additional questions? All righty. Looks like that's the end. Thank you so much. We have agenda item, we're going back to 12, discussion of potential topics. And let me just open it up. This may be something that if you just think about it and you want to email Ms. Cooper, that would be a great thing too. Based upon what we've heard today, I'm sure there are some other topics that people might want to take on. So why don't we do that? Take home assignment. Okay. All right. We are up to now public comment. Anyone here? And BPS, let me know if there's anyone on the phones. Yes, sir.
To provide public comment, please press *9 now to take your place in the queue.
We're going to start here in Las Vegas.
Good morning, Senator, committee. I just was reminded that they had the legislative symposium in Reno this last weekend, and want to remind this committee that the legislative symposium in the South is on April 6th at the Dula Center. That's all I had. Thank you.
Thank you. Anyone up north? Seeing none? Anybody on the phone?
Chair, the public line is open and working, but there are no callers wishing to provide comment.
Okay, let's give it about 2 minutes, just in case. Okay, I don't think we have anybody else. Nobody on the phone? Okay.
There are
All right,
still
everyone,
no
thank you.
callers.
Pardon? No callers, okay. So thank you all for attending. Thank you, members, and they won't hear it until they look at the film, but I want to thank all those who presented. I think the information that we got today is worthy information, and there are probably at least 3 or 4 bills that will come out of this. So thank you all. Our next meeting is scheduled for Tuesday, April the 30th, beginning at 9:30. And with that, we are adjourned.
Super.